I'd like to welcome each one of you who are joining us. If you are live streaming this here in Okinawa, you realize it's pretty calm outside, which is a real difference from the last 2 days. Glad to have you here. If you're not joining us in Okinawa, well, we've had a really exciting time, but wherever you are, whatever I have to say today could be of very, very much value to you. We're basically talking about the theory and the practice of hydrotherapy and other natural remedies, which are very important. But in thinking about hydrotherapy, my recommendation is you get one of these two books. The one on the right-hand side by Drs. Agath and Calvin Thrash, Home Remedies. It's been translated in many languages. It's been used around the world. It's a pretty definitive book. The other book is basically dealing just with the theory of hydrotherapy, which we'll be starting with this morning, just talking a little bit about the theory, and then we'll be doing some practice. We'll have a lecture part with the slides, and then we're going to break, and then we're going to go to some demonstrations. There'll be dry runs, but they're demonstrations nonetheless. Okay, hydrotherapy. It's basically the importance of water, its uses to treat illness, and dehydration signals. Probably won't talk about the dehydration signals. I'll mention them because we've talked about those things yesterday. Let me just mention them right now because we use water on the outside, we use water on the inside. And inside is very important because basically our bodies are 70% water. If we are not drinking enough water, we go into basically acute dehydration. That means if I don't drink enough water today, I will have some symptoms right away, but they're not chronic. If we go into chronic dehydration, which means I just never drink water, my body's going to set its set point down for my water table. Basically, the body's 70% water. If you are just not going to drink your water, your body will accommodate you and will set the set point down, which means you now have a lower tolerance for water. So let's say you get headaches when you're thirsty. Well, now you drink a lot of water because you got a headache, but you're going to keep dumping it out because your body set it down maybe 67%. So we need to keep it up to 70%. Your water is between 90 and 93% water. Your brain, 85% water. Your muscles, 75% water. Your bones, 20 to 25% water. And your teeth are 10% water. If we're not maintaining our intake of water, we'll start having symptoms of dehydration. The first one is thirst. If you feel thirsty, it's a signal from your body that you are dehydrated. You should never feel thirsty. That's when most people drink, though. They feel thirsty, they take a little slug of water, and they stop. You need to stay hydrated. My recommendation is you take small sips of water all day long by principle. It'd sort of be nice if we had to drink water sort of like we have to breathe. You don't just stop breathing and then every once in a while say, I think it's time to take a breath. And you stop again until you think about it. We should drink water almost in the same principle as how we breathe. We just take it on a natural basis all during the day. Okay, so we've got thirst is a sign, hunger can be a sign, headaches, painful joints, so many symptoms of dehydration. Matter of fact, I mentioned blood, brain, muscles, bones, and teeth. Every one of those things will be affected if you're not drinking your water right. Teeth, bad breath. Dental caries, because you dry up your mucous membranes, you got some friction going on, you're going to start wearing out your teeth. So we need to take care of ourselves. Now back to some hydrotherapy. I love this quote right here. God's miracles do not always bear the outward semblance of miracles. Often they are brought about in a way which look like natural course of events. When we pray for the sick, we also work for them. We answer our own prayers by using the remedies within our reach. Water, wisely applied, is a most powerful remedy. It is used as used intelligently, favorable results are seen. I have used so much hydrotherapy in my years. I've given probably thousands of hydrotherapy treatments, and it's amazing what they can do. We'll be showing you some of the very simplest of hydrotherapy techniques. I promise you, if you listen to these things and you do these things, you will see the same miraculous results we read about right here. Okay, treating sicknesses with hydrotherapy. First, we've got to figure out what is hydrotherapy. Hydro means water. Therapy, of course, taking care of the body, therapeutic. There are ranges of temperature. Well, basically, if we're using water, it has three effects. It has a thermal effect. So hot, cold, in between. And each one of those things have a different effect upon the body. It can have a mechanical effect. That was we use water pressure. And I'll tell you a story about using water pressure in a patient I have from Jamaica. And it's sort of an amazing story, what it did for him. And then the other one is chemical. And basically the chemical reaction is water we put inside of our bodies, which has the chemical reaction. Now, as far as temperature extremes, star temperatures, our sun's surface, basically 5,700 degrees Celsius, that's the surface. Go down deeper, much, much hotter. Absolute zero, 460 degrees Fahrenheit. That is, what does it mean, absolute zero? That's when molecules cease movement. They are frozen too. We'll talk about that in just a minute. We're going to talk about in this slide right here. Water comes in three forms in a very small amount of degrees. I like talking Celsius because basically the one form is at 0, the other form is at 100, everything else is in the middle. At 0, water is a solid. That means the molecules are moving very slowly to the point where you can walk on top of them sometimes. In between, it's a liquid, which has everything from 0 to 100. It's still liquid at 0 until it does something else I'll talk to you about in a minute. When it gets to 100, it changes its form into a gas. That means the molecules are moving so fast, they escape the liquid state, and now they're floating around as we call it steam. So in this picture right here, you see all three forms in one picture. You see the snow, which is ice. You see the water in the river. You see the steam rising from a geyser there, probably up in Yellowstone. All right. The range of temperatures for living tissues. We got to keep our tissues within these temperature ranges, about 75 degrees Fahrenheit up to 113 degrees Fahrenheit. Now you can survive hotter than 113, but when the tissue starts getting the hot, the body is made to keep the tissue cool. We'll be talking about that when we're talking about some of the properties of water. But when you start getting above 113 degrees in your tissue, you start to have some problems. But this is the range in which we can have life. Now, temperatures that are compatible with life in our biosphere that we're in, basically 40 degrees below 0, up to 120 degrees Fahrenheit, 22 degrees Fahrenheit. Now, some animals live in colder than 40 degrees minus temperatures, like the polar bear. But he's not that cold. He's got special insulation. You know what color a polar bear is? A polar bear is black. You know, the fur is white, but the skin is black. So when there's sunshine, it absorbs more energy, more heat, which it stores in its body. All right, comfortable room temperatures. Now that's a subjective thing. What's temperature for you may not be comfortable for me. Basically, 86 is high, 59 is low. At nighttime when I'm sleeping back home in the north, I like it cold in my bedroom. Matter of fact, I once had a bathroom, my toilet water would be frozen in the morning. It might be a little bit extreme for some people, but it's whatever makes us comfortable. Now, our body is made to regulate temperature. When we get cold, and sometimes people get cold, not so much here in Okinawa, but it's going to happen, the body has to increase heat production. How does it do that? Well, I think all of us have had this experience. When you're cold and you need to produce more heat, you start to shiver. Shivering is a movement of the muscles which generates heat because you have to burn energy in order to shiver, and the burning of energy energy is also heat. So you shiver, which produces the heat, which warms you up a little bit. Another thing you do is you go into what's called heat conservation. Now, you're not going to wrap yourself up in one of these covers, but basically when you go into heat conservation, it means the body's no longer going to give off its heat. The way we give off our heat is we sweat, and we'll talk about that when we talk about what's going to happen when we get too hot. Now, fever. Some people call hydrotherapy fever therapy. I think that's a misnomer. A fever is a mechanism that God has given us through our immune system to get ourselves well. So basically, fever is a friend. But most people, when they get a fever, what do? They go out and take a medication to bring the fever down. When they bring the fever down, lots of problems. See, when you have a fever, it means that the immune system is working. Something is in your body that needs to be destroyed. And so when the body raises the temperature, it increases your white blood cell count. And it increases the mobility of the white blood cells, so they're out there fighting a whole lot better. So basically, you've got a stronger immune system if you get a fever. Now, many people are very afraid when their children get fevers. Oh, they think that's a... Matter of fact, I remember Dr. Agatha Thrash, she was once asked the question, what happens if my child gets a febrile convulsion? That means they start to convulse when they have a fever. She said, well, that's really worse for the grandparents than it is for the child. It's not a big deal. But here's something. We got this from the Journal of Allergy and Clinical Immunology. Children who ran a fever during the first year were less likely to develop allergies later in childhood. Now, it doesn't mean run out and get your child a fever. It means that if the child gets a fever, just work with the fever. Dr. Thrash once told the story, and I think it's apropos here as we're talking about hydrotherapy. She was just getting in. She and her husband were just getting into this. They had very successful medical practices in Columbus, Georgia, but they became Adventists. They read through some books like Ministry of Healing and Medical Ministry, and they realized we're doing it all wrong. And so they went to a place called Wildwood, and they took their young, very small child, Cal Thrash, who was sick at the time, and they wanted to take the Thrashes on a tour of the facility, but they couldn't take little boy because he was sick, and Dr. Thrash was afraid to leave him because he was so sick. She, being a doctor, she felt like only she could take care of the child. But the woman in the home says, he'll be okay. I'll take care of him. And so they left. Well, while they were gone, the mother gave Cal a hydrotherapy treatment. It was basically a contrast treatment. And I think he might have been 3 years old. So she put him in hot water for 3 minutes. That's the rule, a minute. So it keeps them from unraveling and replicating the microbes, even viruses. It's sort of like the aglets on the end of our shoelaces. Those little plastic things in the shoelaces are called aglets. The aglets keep your shoelaces from unraveling. That's what the telomeres do on the RNA. I know that's a lot of big words, but it just means that temperatures will keep your viruses and microbes from dividing and multiplying. Matter of fact, there's a theory. I read a very interesting article some years ago. After the end of World War I, which ended pretty close to 100 years minus a month right now, plus a month, they had a lot of sickness there. Now, in 1880s, there was a pharmaceutical company in Germany that came up with a medication which they called aspirin. The aspirin was named after two plants, aspen and spirane. And both of these things had the properties of pain relief. And so they made this pharmaceutical, and another company did the same thing, and they went into a lawsuit about this thing. In a lawsuit for a long time, because the other company found it also brought down temperatures. Well, in 1915, the trial ended. The judge declared, okay, Bayer, you can call it a pain reliever. The other people, you can call it an anti-febrile that brings down temperatures. And World War I started. They started using it because when a soldier's in the trenches in France, he's achy or he's got a fever, he can't fight very well. So they started giving him these particular drugs, which brought the temperature and the pain down. And of course, they didn't think much about the fact that 10 days later that person was dead, because whatever it was giving them this sickness sort of took over, and then they had pneumonia and they died in the trenches. But after the war, the news went around the world about this aspirin thing, and some people theorize that the reason for the Spanish flu pandemic was the fact that when a person started getting a fever, they took an aspirin or some other medication to bring the temperature down, which caused the virus to replicate, and then they got so sick, and between 200 and 100 million people died in 1918, 1919. It may have a connection with that particular drug. Okay, temperature regulation. When you become hot, the body's going to get you cooled down. How's it going to do that? We go through what we call heat dissipation, which means you start to sweat. Now, if you've ever had a fever, you don't sweat. See, that's the two different things. That's why we call this hydrotherapy versus fever therapy, or not fever therapy. The body gives you a fever. When the body gives you a fever, you stop sweating. And stopping sweating is going to start building up heat. Why is that? Because when you stop sweating, the body no longer can get rid of that heat that's inside there. Basically, we call it the latent heat of evaporation. If you've ever had a fever for a long time, let's say a number of days, there's going to come a time when that fever breaks. And I've had it happen to me. Matter of fact, I had it happen in August up in Sanakugaken here in Japan. I had gotten sick. I'd had a fever for a few days. And in the middle of the night, I woke up and I was soaking wet. Because when the fever breaks, the body lets the water back out again. That brings the temperature down. And I'll tell you how that does it in a minute. But the body has various ways of bringing the temperature down. One is heat dissipation through conduction. If you sit on something cold, if you're up against something cold, it's going to bring your temperature down. Many times, when I was a child, I had a high fever one time. I remember my father going out, getting a bag of ice, filling the bathtub full of cold water, dumping the ice in and putting my poor little body in that cold water. They don't recommend you do that anymore, but certainly conduction, the cold's going to go into my body and I'm not going to have a whole lot of heat left. We do it by convection. As wind blows upon us, and if you've ever noticed when you're really hot and sweaty outside and the wind blows, you feel cooler. Now there's a reason for that. It's through convection, but something's happening in that convection process. We do it by radiation. Each one of us sitting here are radiating heat. And the less clothes we have on, the more we radiate. So when it's really cold out, we probably should put more clothes on so that heat doesn't radiate out. It sort of stays in our body. And then there is evaporation. Now this is the most important one. We stay at our temperature, 98.6 or 37, whatever you want to call it, through this blessing called evaporation. So let's look at the latent heat. Now latent means hidden. The latent heat of evaporation. Now to do this, we have to define a particular word, a calorie. What is a calorie? We always talk about it, oh, that thing has 250 calories. What does that mean? Calorie is the amount of energy or heat needed to raise 1 gram of water 1 degree Celsius. Okay? Remember that. The amount of energy, and energy is also heat, it takes to raise 1 gram of water. Now, most people don't deal with grams, they deal with kilograms. Okay, so 1 liter. The amount of energy it takes to raise 1 liter of water 1 degree Celsius. And that would be a kilocalorie. Here we're talking about these little calories, just 1 little calorie. So, question, you got the definition in your mind. How many calories does it take to raise water temperature from 98 to 99? Well, common sense would tell you 1, because this is a gram of water or a kilogram, however you're looking at it. It's going to take 1 calorie to raise the temperature 1 degree. How many calories does it take to raise it from 99 to 100? Again, it's 1. But what happens at 100 degrees with water? It changes its form into steam. Vapor goes up. Now, in order to make that change, we have what's called the latent heat of evaporation. It takes more than just 1 degree to change its form. It takes 533 calories to change its form from liquid to a gas. Now, how does that work with the body? How does it keep us cool? When you sweat, sweat comes out there. Now, all of it's not going to evaporate. A lot of it just sort of drips down. But enough evaporates. The body knows how to do this, that as you evaporate a gram of water, it needs that 533 calories. Where does that extra heat come from? It comes from your body. So you're sweating, you evaporate the water. Every gram of water you evaporate, it is taking that heat out of your body to change it back into a gas. So you sweat water, it turns into a gas, evaporates, and you're bringing your temperature down. On the other scale, let's talk about those of you who've ever made homemade ice cream. I used to love to do this. You take a bucket, you've got this crank that turns this thing, you've got a cylinder, that's where you put your ice cream fixings in, and so you put it in there, but there's one other thing you put in. You got ice in the bucket, and you put it in and you start to turn, but ice by itself is not going to do it. When you're in the States or a place where there's lots of snow on the roads, what do they put on the roads to keep it from being slick? They put something called salt. What does the salt do? It causes the ice to melt. And so when they put the salt on the ice in the bucket and you turn it, it's causing that ice to start to melt. But in order for that ice to melt, it has to change from a solid back into a liquid. We call that the latent heat of fusion. How many calories does it have to lose in order to change from a solid to a liquid? 79.7 calories. So basically, where's it going to get? It's in this bucket. Where's it going to get the heat to change from a solid to a liquid? The cylinder. Whatever's in the cylinder, whatever you've put in there to make your ice cream with, it's going to start giving up its heat so it can melt the ice. And now what's happening to the stuff inside the cylinder? It's giving up its heat. It's becoming cold until pretty soon you can't move it anymore. Now it's ready for ice cream. There is a law of chemistry called Van Hoff's law. Basically, the velocity of the simple chemical reaction of almost anything is going to be doubled with 10 degrees temperature elevation, which is something we need to remember when we're giving hydrotherapy to certain people. Now, you're not going to double anybody's temperature, but any elevation at all is going to take advantage of Van Hoff's law, and it's going to increase a chemical reaction. So let's apply Van Hoff's law to physiology, the direct thermal effects. If you take glucose into your body, which we're doing it right now, just to think you've got to be burning glucose. It goes into your body, it's going to break down into three things. It's going to break down into water, carbon dioxide, and adenosine triphosphate. That's your energy. If you heat the area up, it's going to burn more energy. So I'll just tell you the repercussions of that right now, but I'll mention it again because it's very important to mention it twice. If you take somebody who has poor circulation, let's say somebody with diabetes, especially insulin-dependent diabetes, you put their feet in hot water. You've increased metabolism. In the increase of metabolism, no problem increasing energy, no problem with getting more water. The problem is the carbon dioxide. Carbon dioxide starts to build up. Now, if you are insulin-dependent diabetic, it means that your circulatory system is not working so well anymore. You're not able to get all that carbon dioxide off. If you have too much carbon dioxide, what will it do with your cells? It will start to kill your cells. We do not want that to happen. And I have known people who have had amputations because they've heated up an area of their body that did not have good circulation. So basically, you do not want to increase metabolism in an area with poor circulation. And that would be with a hot foot bath. I heard about one guy one time, he was taking a Russian steam bath. The hot water is dripping on his feet. Condensed, drops down on his feet, very hot water, 100 degrees when it comes down, and Celsius. But he couldn't feel it because he had diabetic neuropathy, but it was increasing the metabolism. He had both feet amputated because of that one hydrotherapy treatment. So Whereas hydrotherapy is very simple and very safe, you got to know certain basic principles. We'll go over this again. Another problem with increasing the temperature of certain people is if they're taking medications. Many medications are time-release medications. So you take a medication at body temperature, some's going to be released now, some in an hour, some in 2 hours, some in 3 hours. But if you increase the body temperature, then what's going to happen is you're going to increase the metabolism of the drug itself, and you can now dump the whole dose at one time, and the body's not made to take that. I've already mentioned hypothermia, contraindicated for someone with poor circulation or someone with swelling. The problem with swelling, if someone has a swollen foot, all right, let me just back off here. What do you do with somebody? Let's say they've twisted their ankle, they've got a swollen foot. What do? You use ice. You use ice for the first 24 to 36 hours. Not constantly, of course, but you keep icing it. By then, you have restricted the blood flow, and now you can go to a contrast hot and cold treatment. I did this to myself one time. It works great. But if you just got swelling, basically as you swell, you increase the permeability of your blood vessels because they are expanded because of the swelling, and heat's only going to do more. It's going to increase the tissue leaking in your body. So you increase the heat, you increase the permeability, you increase the swelling. Not a good thing. So if you're swollen, don't use heat, use cold. Another time not to use hydrotherapy, hyperthermia. Hyper means high temperatures, is when you have a loss of sensation. A person just can't feel well, and that's going to be the person with the diabetic neuropathy, Berger's disease, leprosy. You don't want to give it if they can't feel it. Now, if you're giving let's say a tepid foot bath, you can feel how hot the water is yourself. And you can feel it. This is not going to hurt you because it's very low temperature. But for the most part, keep them out of the hot water. Derivation. Now, we're getting into some of the physiology of hydrotherapy. Derivation. Let me just give you an example right here. All right, we've got the increased metabolism. Shallow penetration. If you apply heat to the surface of the skin, the blood vessels are going to dilate. But in order to dilate, which means they got bigger, it's got to have blood to fill those blood vessels. Where does that blood come from? The blood comes from the deeper lying tissues. So basically, if you bring your blood to the surface, tissues underneath are not going to have as much blood. And that can be a good thing if you have congestion. Let's say we're doing hot fomentations to the chest. You put hot fomentations on the chest, and you'll find that when you remove it, it's red. That means the blood came from the chest, which is congested, to the surface, and now you breathe easier. So let's see derivation at work. Let's say a person's got a headache, chest congestion, abdominal cramps, dysmenorrhea, many different problems they can have. So they get a basin of hot water, again, making sure they don't have something that bad circulation. And you're going to have what we call vasodilation and vasoconstriction. Basically, when you put any part of the body into any temperature of the water, it's your nerves that are going to react. They're the ones that send the signals to the blood vessels either to dilate or to constrict. So let's say we put the person's feet into the hot water. What's going to happen? They're going to have a dilation of the blood vessels in the lower parts of their body. Now, in order to have, when that happens, that means you've got more blood down here. The common sense is you're going to have less blood up here where you're having the congestion in the first place. And so you're going to have a dilation of the blood vessels in the head, in the chest, in the digestive area, in the pelvic area, which means you're going to remove congestion, and congestion causes the pain. If you know somebody with a headache, now I recommended yesterday, drink a glass of water every 10 minutes for an hour. But if you don't do that, what you can do is put a person's feet or even their hands and arms in hot water, which is going to draw down blood from the head, relieving the congestion in the head. It works very nicely. When we go into cold, the heat goes to the core. When we get into hot, the heat goes to the surface. So let's look at some hydrostatic effects of heat. You put someone in the hot. So you've drawn blood to the surface. That's why we turn red on the surface. It will speed circulation. So you've got a larger blood vessel now. The blood's going to move faster. So you go from a 2-lane highway to a multiple-lane highway. We look at it this way. Each car, let's say each car is a red blood cell. When we get into hot, we've got more highway space, more red blood cells. It encourages perspiring when you get hot because that's the reaction to being hot. Why is it good to perspire? Well, we have 3 kidneys. We got the 2 placed back here in our back, but our skin is a 3rd kidney. If we sweat, we're throwing off impurities. If we give a hot foot bath, which we'll be demonstrating in a little bit, to a person who is addicted to tobacco, they're smoking all the time, and we want to try to get that nicotine out of their bodies, we wrap them up in a sheet, put their feet in hot water, and bring them into a sweat. When you remove the sheet will have yellow stains because it's taking that nicotine and those tars right out of the body into the sheet. So it can be a very good one. It encourages perspiring. We detoxify our bodies, and we all need a good detoxification. Now the hydrostatic effects of cold. When we get into cold, it's going to the first reaction is going to drive the blood from the surface into the center. But the body realizes, look, we need to get that place warmed up. So the second effect will be you start to warm up. If we do a thing called an ice massage, whenever I teach ice massage, I tell the people you rub the skin until the skin turns red. It's not turning red because you're forming a rash with the ice. It's very smooth. It's basically, you put it on there first, it's going to blanch. It's going to get very pale because all the blood dives as deep as it can get because it does not want to be cold. But then the body says, no, we've got to get the blood there. And the more you rub, it starts to turn a different hue, a darker hue. And when you get there, then you've got some good circulation on the surface. Now, I mentioned what happens when you apply heat to the surface. You got a dilation of the blood vessels, and the blood vessels down below are going to get smaller. But if you put cold to the surface, then you're going to have a constriction, and you're going to increase blood flow down deeper, which means that the penetration of the cold is going to go much deeper. You see, when you put hot on your surface with the dilation of the blood vessels, it's going to take that heat away. It's going to be carrying that heat somewhere else where it's cooler. But when you put cold there, it dives down deep, and now the deep cold's going to get deeper and deeper and deeper until the body warms it back up. So it's going to slow down the circulation. You go from that multiple lane highway down to one of these little Japanese roads to the rice fields, very, very narrow. And sometimes we want slower circulation. It also slows down metabolism. Now, I just said sometimes we want slower circulation. Well, that's when you sprain or strain a joint. You want to have less circulation because what happens when you sprain your ankle, more blood comes to the area because the body says we've got an injury, let's bring the white blood cells down there, which stretches the tissue, which causes more pain. You put the ice on, you cut down the circulation, you don't have as much swelling. As a matter of fact, if you sprain your ankle or any other joint, you do 4 things. We call it RICE. You rest the area, you don't keep walking around. Ice it, you want to put the ice on it. C, you constrict it. And E, you elevate it. All these things are going to keep the circulation from going into the area. So sometimes you do not want circulation, and that's what cold does. It slows down metabolism. It has a numbing effect. I had an accident some years ago. I cut off the tips of 2 fingers. And when I went down to the lifestyle center at UT Pines, first the doctor said, someone go back and find those fingers. We got to put them back on. And they couldn't find them. They got pretty messed up. And so I said, I don't want to use Lanacane. I don't want to use any pain reliever. Because they asked me, first thing the nurse asked me, are you allergic to the canes? You know, we take Novocaine, Lanacane, other types of chemical painkillers. I says, I don't want any of the canes. I says, get me a glass of ice water. They brought me a glass filled with ice with water in it. I stuck my fingers down in the ice water. That's a great pain reliever. I'm sure the other one would have taken all the pain away, but here's the problem with using these pain relievers. When they wear off, you'll have more pain than when you started with. So I just used the ice, and then they gave me white willow bark tea. They gave me a whole quart of this stuff, and that's what I drank. We can handle the pain. Now, some people have a very high threshold for pain. I do. Some people have a very low threshold for pain. So we're not going to sit there and say, you've got to do it the way I do it. But I recommend you, if you best you can, ice will usually take away most of the pain and is a whole lot better for you. Now, when we talk about hyperthermia or hypothermia, we've got different temperature ranges. So we're going to look at some of the therapeutic temperature ranges. Very hot, basically 105 to 110. Above that, you could get into the point where you might be damaging your tissue. But people are different like that. Some people, they say, oh, it's too hot to touch. They got a hot potato. I just reach over, grab the hot potato and sit it down. Some people are less sensitive to the heat. But if you're doing hyperthermia, if I'm doing a hyperthermia treatment on somebody, let's say that has cancer, hyperthermia means putting them in water to raise their thermal temperature inside their body. I will usually use water that's 111 degrees. This says 110 degrees. Usually people, that's too hot for most people. So this is in a good range, 105 to 110. Now, when you raise a person's body temperature, what is the range you're looking for? If I'm dealing with cancer, I want them at 104, or which is 40 degrees Celsius. 104 degrees is a good temperature that can bring your immune system to the max. It can also kill some viruses or kill the cancer cells. I was teaching hydrotherapy at Bogenhofen in Austria some years ago, and I was teaching a young man how to do it. They had 2 bathrooms on campus, 2 bathtubs, and I was in one of them. And so he put me in the hot water, and he was using my thermometer. Well, he uses Celsius, I use Fahrenheit. So he'd look at it, he has no idea what all those numbers mean. And so he was going through the drill every 5 minutes, take the temperature. And at one point I says, let me see it. I looked at it, my temperature is 106.2. Now, that's not dangerous. It gets dangerous, it gets higher than that. Someone could go into carpal pedal spasm at high temperatures, but I usually say don't go above 104. And I went to 106.2, not a problem for me. Years ago, a big problem, one of the main venereal diseases was syphilis. Still is. As a matter of fact, it's having a resurgence. In the 1800s, 1700s, they used calomel or mercury to treat it with, which means these people all had very short lifespans. Then they got into hyperthermia. And here's what they would do. They would raise a person's body temperature to 105 to 107 and keep it there for 5 to 6 hours. Very hard to do, but it would kill the spirochete that caused syphilis. And they do this for a number of treatments in a row. I say it's caused by a spirochete. There's another spirochete causing another disease, which is far more common today than is syphilis, and that is a thing called Lyme's disease. It's the same type of an organism. It's killed the same way. And when we have patients with Lyme's disease come to UT Pines, we put them in a hydrotherapy tank, and we raise their temperature between 104 to 106 and keep it there for as many hours as we can stand and as they can stand too. Now, when they used to do it for syphilis, they would put the person asleep to do it. It's very, very hard to sit in hot water for 6 hours. I know. I've done treatments on people. I haven't done it on myself, but we want to get high temperatures when you're really serious, and Lyme's disease is a very serious disease. So, very hot, 105 to 110. Hot, 98 to 104. Now, 98 is about our body temperature. I don't really consider that hot. As a matter of fact, if you put your hand in 98 degree temperature, that's what you feel like, although it's going to feel a little bit warm. But this is what we called hot. Then we have neutral. Now, there's a reason for neutral. Now, we use the first two temperatures, very hot and hot, to raise the body temperature. For the neutral, it's basically where the body is. This is sedative. If a person can't sleep, we give them what we call a neutral or a tepid bath. Now, tepid might be a little bit more on the cool side. The neutral bath, they just slide in and it feels like they're back in the womb again. It makes them tired. It's great for somebody who cannot sleep. It's great for somebody who is having some psychiatric problems. You got to sort of settle them down some. Okay, a tepid bath, this is a good one to wake you up in the morning. It's very good to take cold baths. Tepid, not so cold. You get down to 66 to 80 degrees, now you're into a cool bath. This is almost as powerful as a hot bath for strengthening your immune system. This is when your erector pili, those little muscles that pull your hair straight up, you're going to start having goosebumps. Cold, 55 to 65. And that's really cold. You will feel cold. It's going to be, but once you're in, it's amazing. Once you get in water at this temperature and you're staying there for a few minutes, all of a sudden it doesn't feel cold anymore. And because your body adjusts to it. It's interesting, if you get in water at this temperature, it will increase your metabolism because what's going to happen? Your body says, oh, it's cold out there. Let's generate some more temperature. So it generates more temperature. And how does it do that? It burns more glucose, or it can burn your fat, which is a form of stored glucose. And it increases your metabolism for quite a period of time, which means it helps you lose weight. And then very cold from freezing, 32 to 54 degrees. I think that's where it was the other day when I was in a sauna, and I go from the hot water to the cold, and the cold, I could hardly stand it. I usually go down up to my neck and sit there until I no longer feel it. I never got there. I had to get out because it was killing me. Okay, we cannot disregard the laws of nature without disregarding the laws of God. We're talking about the laws of nature here. We cannot expect the Lord to work a miracle for us while we neglect the simple remedies He has provided for our use, which aptly and opportunity, that means the right way and the right time applied, will bring about a miraculous result. Therefore, pray, believe, and work. We answer our own prayers. Now, this was written by a little old woman named Ellen G. White. But it's the same principle that Lord Palmerston, who was the Premier of England from 1855 to 1865. And this is what he said. There was a cholera epidemic going on up in Scotland. And so the clergy sent a message down to Lord Palmerston. He says, they said, please declare a day of prayer and fasting for this cholera epidemic down here. And is that a good idea, to pray and to fast? Yes, it's a good idea. It's a wonderful idea. But this is what he wrote back. This guy was way ahead of his time. Here's what he said. Cleanse and disinfect your streets and houses. That's the first step. Now, remember, it was a cholera epidemic. What causes a cholera epidemic? Unclean surroundings. Unclean environment, bad water, bad everything else. So cleanse and disinfect your streets and houses. Promote cleanliness and health among the poor, because that's the one that's going to be having the problems. See that they are plentifully supplied with good food and raiment. Okay, get them in some nice good clothes, give them some good food. Employ right sanitation measures generally. All right, those were the conditions. Do these things. Now, he's not done yet. Listen to what he says next. And you will have no occasion to fast and pray. Why? Because what was causing the problem, he just said eliminate that. We talked about the basic principle of health the other day. Reason from cause to effect. Remove the cause, you remove the disease. He says you will have no occasion to fast and pray because it's gone. But now, the last thing he said, to me is the most astounding thing. He says, nor will the Lord hear your prayers while these, his preventives, remain unheeded. You understand what he said? If we do not do what God asks us to do not ask him to help us with our problems. If you've got a smoking problem, you get lung cancer, don't pray to get rid of the lung cancer until you've gotten rid of the tobacco. I know I'm being strong here, but if we continue to violate the laws of health, if we continue to hurt our bodies with our foolishness, with our lifestyles, whatever it is, we cannot expect God to take care of the problem. So anyway, now, if we start to get sick, everyone, when they start to get sick, has a signal the body's going to produce. For me, it's a sore throat. If I wake up in the morning and I have a sore throat, I know somewhere I have been infected by somebody and I'm going to be sick. But at that moment, and every one of you have one of these. Some people get a little headache, some people a little stuffy nose, but whatever it is, we know what our signal is. If we immediately, within 20 minutes of recognizing that signal, we start our defense. So basically, we nip it in the bud. So what do we do if we feel that symptom? Now, I'm telling you, I know what to do, but I'm also going to tell you I rarely will do it. Because this is what I have found in people who are into natural remedies, we don't do it for ourselves. I live the lifestyle, but the treatments, not so much because I'm too busy. Trouble is, if you're too busy to keep from getting the illness, you'll have plenty of time to have the illness. Believe me, you will make room to be sick. Okay, so what do? What's the first thing you do when you feel any symptom coming on? First thing, you drink 1 glass of water every 10 minutes for 1 hour. That's what you do for a headache also. But what you want to do is you want to rehydrate yourself. Now, in between the glasses of water, you don't just sit there waiting, okay, 10 minutes drinking water. What you do is you go outside and take 40 to 50 deep breaths of air. We're talking about deep. You bend down, you pull your rib cage, 40 to 50. Now, it's not between every 10 minutes because you'll pass out from getting too much oxygen. But within that hour, you're taking 40 to 50 deep breaths of air. Plus, after a while, you're going to start going to the toilet a lot. So if you do that, that will stop almost every sickness that you've got coming on your body because you have hydrated yourself, you have oxygenated yourself, you've increased your circulation, many good things just with those two things. Now, the test will be, will you do it when it feel it coming on? I recommend you do it. Okay, I said nip it in the bud, water and breathe in your air. But there's a second line of defense. Microorganisms bother us are going to sick, they wear the mask. In America, no one wears a mask except for the guys robbing the bank. But we need to protect the people around us. We have, although natural things in our body that will protect us from things that are in the air. You see in this particular slide here, we've got 3 sets of sinuses in our heads. They've got mucus inside these sinuses, and there's an enzyme in there called lysozyme. Lysozyme was discovered by Sir Alexander Fleming, and this is what happened. He was in his laboratory. He had a petri dish, a bunch of petri dishes that had a medium in there. We usually use agar-agar, which basically it gets solidified like Jell-O. And he would put some type of a bacteria or something on there and let the culture grow. And then he would put different medications he'd been working on in there to see if it had any effect. So this morning, he'd come to work and he had the cultures growing. He opened up one of the petri dishes and he was getting ready to put this medication in there, and a droplet of mucus drops out of his nose into the dish. Well, we know that now contaminated the dish. He put the lid back on. He says, that's a waste. He moves it over. He came back later. Everything in the dish was dead. He discovered lysozyme, an enzyme living in our sinus passages that will kill bacteria and viruses. That's why we need to breathe through our noses and not through our mouth. But we need to make sure our sinus passages are kept in good working condition. And how can we do that? We can do what's called a nasal irrigation. Now, we're going to demonstrate how to set this up, but I'll just show you what it is. If you can get a thing called a neti pot. A neti pot is what this girl's using in the upper left-hand corner. You put remember this word, saline, in there, and then you put it in your nose and just dump it in, and it will run out the other nostril or down your eustachian tube, and you just spit it out. I have, I don't have a neti pot. I do have a water pick. You can use that. You've got a special applicator you put on the end. You put it in there, pour the water in, turn it on. Just don't turn it on high, because that might blow it out your ears. Well, it really won't, but it's not going to feel good. You put it on low, it's going to pump, 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 pump that water up through your sinus passages, down through your eustachian tube or out the other side, and you're cleaning it out. So what is saline? 1 pint of warm water, 1 teaspoon of salt. That is saline. Every fluid in your body is saline. You know it is. Have you ever tasted your sweat? It is salty. Have you ever tasted your tears? They are salty. Have you ever tasted your snot? Not since you were 3 years old. But everything in your body is, even your urine is going to be saline. That's why when you have high blood pressure, they give you a diuretic to make you urinate more, because urine is going to take salt out of the body. So we want to do this. Now, when I learned this the first time, and I started getting a stuffy dose, I decided to do myself a nasal irrigation. But I forgot the thing about the saline. I just used warm water and the water pick. Now again, I'm one of these guys that think that, okay, if it hurt, it must be good. So I'm sitting there, pump, 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 and it's just killing my brain, because I'm pumping warm, regular water up my nose, and it was a killer. So make sure it is saline. Your body wants saline up your nose. Another thing you can do, if you have, and this is the next treatment is for any part of your body, but we're talking right now about the head. Many of us, when we have a sickness, it's going to manifest itself in the head. We're going to have a stuffy nose, runny nose, earaches, sore throats, whatever. This area right here is going to be very much affected. So we can do a facial contrast bath. So you make basically 2 basins, and here we're going to use these small ones. You put your face in hot water, as hot as your face can stand, for 3 minutes. Then you go over to the cold water. Now, when you're in the cold water, you always do this with somebody. They add more hot water to the other side, even a little bit hotter, because when you come out of that cold, the hot's going to feel pretty good now. I was treating a young man who had a very, very bad sinus infection. He was to the point he was almost deaf, because it's all attached in here. And I was doing this, but there's a problem with this. It's hard to keep that poor boy's head under water for 3 minutes. And I wanted his whole face. Wow, he'd be struggling. No, I really didn't do that. But he couldn't stay underneath there for 3 minutes. So I had to keep his mouth out. And I really wanted his whole head in there. I wanted a lot of hydrotherapy going on. And I thought, what can I do? Well, I had lived in Hawaii for 3 years, and I happened to have a snorkel. So I brought the snorkel over, and I had him put the snorkel in. He put his face down in the hot water. I'm sitting there reading the book, keep an eye on it. At 3 minutes, I just tap his head. He'd go in the cold water, 30 seconds, tap his head, back and forth, back and forth. He got completely well. I mean, completely well. So any problem with your face, even dental problems, if you're having toothaches and stuff. Now, there's other things you can do for toothaches. You can use clove oil. You can use a piece of garlic, keep people away anyway. But again, like I say, this is for the face. You can do this on any part of your body. When I sprained my ankle some years ago, I did ice for the first 24 hours, and then I did hot and cold contrast. Now, I'm telling you, this was severely sprained. I did it on a Wednesday night. Thursday morning, I had to drive from Alabama to Kentucky to give a weekend series of meetings. And I had a clutch vehicle. That was really painful to try to move that clutch because it was my left foot. I used a stick to work my clutch. But I'd been using ice. I got to my friend's house in Kentucky, did alternating hot and cold treatments. And I mean, my ankle was completely purple because it was, all the blood vessels had broken loose. By Friday, the pain was very manageable. By Sabbath, still purple, I had no pain. I was walking normally. It's amazing, just hot and cold treatment. Another thing you can do for your face, it just put some heat on your face. Just sitting there in front of a lamp, allowing that heat to hit your face is going to be very healing for your face. Or you can use a heating compress. What's that? Just take a washcloth, fold it up, put it in hot water, wring it out, not so hot you can't stand it, but then you just lay it over your sinus area, your nose and over your cheeks, and it's very, 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 very good for someone with a sinus infection, any type of problems in their sinus area. And you can do steam inhalation. Now, all of these things we're going to sort of dry run demonstrate for you here in a few minutes. But what you do here is you get a bowl, pour boiling water into it, add some type of essential oil. I recommend eucalyptus or pine oil. Both of these things are very healing. Then you take a towel, hold it over your head, and breathe the vapors. Now, when I've done this at Andrews University, we would use a poly pot turned on. And the problem with that is, that means the water's boiling. If you get too close, you're going to poach your nose because it's coming out steam. And when that steam hits your nose, and you don't want it to hit your nose, because what's it going to do? It's going to give up 533 calories because it's going to turn back into water. Now you've got a very serious burn. So you've got to stay way far away. But if you just pour boiling water into a bowl, you'll have a couple of minutes of good steam inhalation. And many sanitariums I go to, especially in Eastern Europe, they will have a room just for steam inhalation. They'll use things like lavender for people who are, they need to relax. There's all different types of therapeutic, they call them essential oils. Learn essential oils. They are good for the body. Okay, let's say whatever it was that got into your nose did not get stuck by the mucus, did not get arrested by the lysozyme, and now it's down in the lungs. Well, the lungs are very beautiful things. We've got cells called goblet cells. Goblet cells produce a thing called gel, which is basically mucus. Between the gel layer and the surface of the lung is going to be a soul level or water. That's a water level. If we're not drinking water, our lungs are going to suffer. We've got to stay well hydrated for our lungs' sake. All right, so we got, and then on top of the surface of the lungs, we got things called cilia. Now, cilia are pretty amazing. They oscillate between 7 and 22 times per second. How fast can you sweep your room? We're talking about sweep, 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 sweep. 7 to 22 times per second, these things oscillate. Why is that? Because it keeps everything flowing. Everything's flowing through your lungs because these little cilia always working. Now, let's say something got past, you breathe through your mouth, or something got past the nose, and now you've got some bacteria sitting in the gel layer. It gets stuck in the gel area. Well, the body wants to get it out. And so the cilia is going to be moving, and it sweeps that out. Now, where does it go? It goes to what we call the mucociliary escalator. So here's what it happens. You have something in your lungs, the cilia is sweeping it out, and it's got two places it can go. One, it sweeps it up the bronchial tube, up your esophagus, goes out, and you spit it out. A big old hawker out there. Another way is it comes out, up through your bronchial tree, esophagus, and then you swallow it, and it's killed by your digestive juices, your hydrochloric acid. But when you get sick, the gel layer gets very thick. Have you ever had a problem when you had a real cold and you cough up a lot of this yellow mucus? That's because you got a lot more gel being produced because the body says we're sick down here. What can you do about that? You've got to break this gel layer. You've got to make it more liquid, and so you do that with garlic tea. Just putting garlic in hot water, add a little bit of salt, or don't add salt first. Put it in hot water, add a little bit of cool water until it gets tepid, and then drink tepid garlic tea. Now, in my Bible, in Revelation chapter 3, what happens when the Lord drinks the lukewarm water? Spits it out. It can cause you to throw up. Now, remember the last time, maybe you don't want to remember, but I know that when I have thrown up before you throw up, everything breaks loose. You're salivating, your eyes are watering because the body's getting ready. It's making everything liquid so something doesn't get stuck in there. And so basically that's what's going to happen. If you drink tepid garlic tea, which is not really appealing, you might throw up. And that loosens up that gel layer. It's also a great thing to do for someone having an asthma attack because that will loosen up, that will cause the bronchial tree to dilate. Now they can breathe again. So if you do it to the throw-up point, that's fine. And then you make them a second cup. You keep that one warm, add a little bit of salt, which is savory, which now makes it a very nice tasting tea. And you drink that, and that will, again, loosen up that gel layer. If somebody eats garlic, let's say someone eats a bunch of garlic and walks into the room, do you know they ate garlic? You know it right away. Why? Do you smelling their breath? No, you're not that close. When you eat garlic, it goes, the allicin, the phytochemical in garlic goes to your lungs and it expresses itself through your breath. So now you are breathing the garlic. So basically garlic is one of the best things in the world for your lungs. Now, if you have a lot of congestion, you can do some things called postural drainage. I'll show a couple of pictures here. This one, I like to use cupping. And we're not talking about karate chops. We're not talking about slapping. We're talking about cupping. And you can cup a person. You can lay them on a slide and you cup, because basically you got various lobes of your lungs. You can do cupping on the chest, under the arms, and on the back. What I like to do is what we call postural drainage. You lay a person on a bed, at the waist down on the bed, and then the waist up, they're leaning over, and you got a basin down there, and then you've given them some garlic tea, and you have them cough, because coughing is the body's way to try to get rid of this stuff. And while they're coughing, you are also doing this cupping on their back, and you're jiggling it loose, and they're spitting all that saliva, all that mucus into the basin that's just below their face, and it relieves a lot of the stuff that's in their lungs. You can do this with children. There you wouldn't do the big cupping. You can just do it with your fingertips, just a little bit tamping on their backs, and it is amazing what it can do. Another thing I like to do when I feel myself getting sick is take oregano or oregano, however you pronounce it. Oregano and thyme oil, 3 drops of each. Now it depends on which type of oregano oil you're getting. I have a oregano oil from Greece, and 3 drops is almost too much. Most people can't even handle the 3 drops. It is so hot. But this is a fantastic immune booster. Both oregano and thyme are herbs that God gave us for not just making our spaghetti taste better, but it gave it to us to make our bodies better. And we just use it, a little bit of olive oil. Basically, why use the olive oil? The olive oil, I have found when I use it with these 2 other oils, makes it a little bit easier to go down. So I recommend we do that. Tastes terrible, but it works wonderful. And someone's going to say, well, how often do we use it? It doesn't matter. You can't overdose. I usually would do this 3 times a day, 3 drops 3 times a day. Now, if I'm using some type of oil of oregano that isn't so powerful, I'll use 10 or 14 drops because I just don't like to be sick. All right, hot foot bath. We're going to demonstrate a hot foot bath, what you can do to derivation, raising the body temperature, detoxify, so many things you can do with a hot foot bath. Increasing your vitamin C intake when you're sick. Now, here we've got some citrus, and we got kiwi and strawberries. You've got just as much vitamin C, if not more, in things like green peppers and red peppers and yellow peppers. There's many good sources of vitamin C. And if you got to take the tablets, take the tablets. Hot, unsweetened lemonade. That means just squeezing lemons into water is extremely good for your body. If you have a sore throat, or really any painful part of the body, we usually just demonstrate with a sore throat, you use what's called a heating compress. What's that? You take a piece of cloth, you put it in cold water. I thought there was heating. Yeah, it is. You put the cold cloth in water, wrap it around a person's neck, wrap that up in plastic, and then put something heavier around that. See what happens when it gets cold. Remember I told you what happened when you put cold on the body? The first reaction is constriction, and then it's going to be dilation. So now, once it feels as cold, the body's going to start sending heat there, more blood to dilate the blood vessels to try to warm the area up, and that's going to bring more white blood cells. Now you're fighting whatever the problem is, but since you've got it wrapped in plastic in a heavier cloth, now you are trapping the heat and you're raising the temperature. Now you've got a hyperthermia treatment going on. If you do this with a person, my recommendation is, especially an old person, once you've got it on, in 10 minutes, stick your finger down there. If it's still cold, take it off. Their body has not got enough vitality to heat it up themselves. But for most people, it's going to get very warm. I like to do these type of treatments at nighttime, because at nighttime, you don't have to worry about people saying, what's that wrapped around your neck? You do it at nighttime, you wake up in the morning, you take it off, you do a good frictioning with cold, and then you dry it and you wrap something warm around it. It's a wonderful thing for sore throats, for laryngitis, for any type of throat problems. Even if you have still got your tonsils, which most of us old folks don't, if you still have them, it's a good treatment for that too. Contrast showers is another fantastic treatment for people who are feeling themselves getting sick. You turn on hot water until your skin turns red, then you put on cold water for 30 seconds and do a dance in there, and back and forth, back and forth. Very good for stimulating the immune system, getting your circulation going. There's basic laws of health, and this one deals with perfect health requires perfect circulation. We've got to circulate our blood better. If we do this with things like contrast, we're going to do it. The nice thing about simple treatments, you can do them just about anywhere. I was in the country in Namibia some years ago, and there's this young man here. He was a clown. He just loved to dance around and just show off all the things he could do. But one day, he wasn't doing so well. Now, both of his parents had died of AIDS. I don't know, he might have been HIV positive himself, because usually they are. But he was really bagged out. And he lived in a compound. When I say a compound, we're talking about a mud hut in a little corral up the road a little ways, the dirt road. And he lived with his grandparents. Well, I had taken 2 students with me to Namibia or to Africa that year, and they went to visit him on a Friday night. I had a meeting in a church, and they came back and says, you got to see him, there's something wrong. So the next day we went to visit him. Now there's Sabbath, there was a Romanian doctor, that's who's carrying the young boy, and in this picture you see a Romanian pastor, you see the Romanian doctor, and the doctor's holding the stethoscope so that one of my students can hear, because he is saying, listen to this is not a good sign. The child was very, very sick. And the doctor says, I can't help him. I didn't bring any medications. Well, that's okay, because God has the medication. Temperature is very high, so he gave him what's called a wet sheet pack. Now, this is not a sheet. This is what's called a shitingi. A shitingi is the thing you see women in Africa wrapped up in, as a cloth. They wrap their babies around themselves. They do so many amazing things with their shitingis. We wrapped them up in this cold, wet sheet, which was going to help bring the temperature down a little bit. That's good for about 12 minutes, because then the body warms the sheet up. Then I said, we got to do the second treatment. So I took him outside to what I call, well, this was the Namibian wash machine. It was a large basin. I put him in this large basin of hot water, wrapped him up in a towel, and then kept dousing the towel, sort of like when you baste a turkey, basting the young man with hot water. Why was I doing this? When your body gives you a fever, it knows where it wants to go. Let's say it goes up to 103. What happens if I put you in an environment that's going to raise it to 104? What's the body going to do? The body's going to say, uh-oh, we overshot. It will set the thermostat down, and when you get him out of the water, it goes back down. But at the same time, by raising the temperature higher, you were helping his immune system fight harder. So I put him in the hot water for 7 minutes. Why 7? We estimated he might be 7 years old. 1 minute for every year of life. Now, from 0 to 3, it's 3 minutes. 4 years is 4, 5, 6, 7, and up until they're a little bit bigger, and you can start doing the full-blown treatment. So I have him in there for 7 minutes, putting that hot water on him. Then I stood him up, and I poured cold water on his body. You can see he's not too pleased with me. He's looking away. It's amazing. African children are stoic. I was in the same country, Namibia, and a young man came to me. He had fallen and cut his chin open right down to the bones. I mean, you could see the bone. And, you know, what are you going to do? So I took him in, I cleaned it, and then I closed the wound. And you only knew he was in pain because tears were coming down his face. He never moved. He didn't move a muscle. When I moved the tissue, when I was putting in the sutures, nothing moved in him. but the tears. They're amazing. Women there, they're working out in the fields, they're pregnant, they feel the baby coming, they go over, they squat down, have the baby, strap them on and go back out, keep working. Yeah, we're a bunch of wimps, quite frankly. So anyway, I got done with the cold. The doctor dries him off, gets him dressed, takes him inside. Now he's hungry. And a half hour later, he's up playing in the room. This is God's treatments. People see these things. The doctor was blown away by it. He never seen anything like this in his life. I see it all the time. Because see, when you do this, a pharmaceutical company is not going to get the glory. The doctor's skill is not going to get the glory. God gets all the glory. But there's another treatment I like very much too. And I'm going to end with a Bible verse on this one because it sort of sums up what I just got done saying. But this treatment is charcoal. Charcoal is one of the most powerful remedies for almost anything you can think of. And I recommend that everybody have some standing by because you need it. Charcoal is pure carbon. Now there's 3 types of pure carbon. Graphite, which we don't think much about, is a good lubricant. Second one is charcoal. And this is a picture of a charcoal granule. Notice how it's very vascular. It's got all these holes, cracks, and crevices. Does anyone know what the 3rd type of pure carbon is? Some people wear it in their ears. Some people wear it around their neck. Some people wear it on their finger. It's called a diamond. Basically, medicinally, a diamond is worthless. If I were sick, I would want a cup of charcoal more than a chest full of diamonds. You can't take diamonds to the grave with you. So anyway, how does charcoal work? It does not work like a sponge. A sponge, in order to absorb water, has to come in contact with the water. Charcoal does not. Charcoal works like a magnet. It will pull things towards it. Through the capillary action, electrostatic action, we don't even know how all it works, but it does work. And it comes in many different forms. We can get it in a powder, which is probably the most versatile way because you can use it any different way. Tablets, I usually carry tablets with me when I'm traveling. In an airplane, you don't want to take out this black powder and start mixing it in the airplane. They're going to throw you out the door because this guy got another terrorist here. But charcoal tablets, you can pop them in, no problems. Now, what about burned food? Is that charcoal? Well, yes, it is, but it's also carcinogenic. You don't eat burned food. You don't eat burned toast. These things, you've burned up you're scorched the proteins and other things, and they become carcinogenic at that point. Okay, the charcoal advantage. One, it's very easy to make yourself. Now, usually when I go to different countries, I have the students making it. This is my students in Moldova. You dig a deep hole, you build a good fire in there, and then you get something to cover the hole with, usually a piece of roofing material, some tin, whatever, and then you leave it there and put the dirt back on top. The next day, the fire's out, the heat's gone, you open it up, and you got charcoal. Usually what my students do, they want to eat it right away just to see what it tastes like. But I found a better way of doing it. Here in Okinawa, you've got some of the best material for making good charcoal. Now I don't know if you know what this is. If you're American, you do. If you go to any thrift store or at Christmas time, people send you cookies. What do the cookies come in? They come in tins, this metal container. It has a lid you just pull off and it's full of cookies. Well, you go to any thrift store in America, you're going to find plenty of those things. You take that tin, you take bamboo, you split the bamboo into, pieces big enough to fit into the container, and about as wide or a little bit wider than a pencil. You fill it full there, you put the lid back in, you poke one hole in the lid, usually about 1/4 inch in diameter. You put it in a hole in a fire. You have a fire all around it. As you watch that can, you're going to start seeing sometimes smoke come out, sometimes steam come out, sometimes even flame. And the flame's not inside. As the gas comes up, it now gets oxygen and now it ignites. You do that until nothing else comes out of the hole. Then you remove it from the hole. Let it cool, open it up, you've got charcoal. Matter of fact, my water bottle is full of charcoal sticks, bamboo charcoal. It filters the water. So you can make your own. If you want to, you can pound it up, make it into powder. It's very easy to use. If you want to take it internally, you just put it in water, mix it up, and drink it. It is also totally safe, totally harmless. You cannot overdose on charcoal. You can take as much as you want, anytime you want. It's good for any part of the body. Now let's look first at internal uses. When would you want to use it internally? Poisonings. A lot of people get poisoned every year in the United States. Matter of fact, it's one of the best treatments for people who have aspirin or Tylenol overdoses. But how did they learn that it had that property? There is a scientist in France back in the 1800s who, before the French Academy of Sciences, he took enough arsenic to kill 150 men at one time. He took the arsenic, mixed it with charcoal and water, and drank it in front of the people. Everyone thought he was going to fall down dead. He had no negative effects. So basically, it took up the toxin. Any of your cleaners in your house, every cleaner in your house just about is going to be toxic. If the child gets into it, you've got to have charcoal. The medications that you have in your house, if your child gets into your medication, they can kill your child. Charcoal's the thing. Matter of fact, in America, emergency rooms, they used to use, if a person had poisonings, they'd give them what's called serpivipacac. Serpivipacac is basically a poison itself that makes you throw up. But the problem with that was some people do not get the gag reflex with it. So they gave them another dose until the serpivipacac killed them. Then they realized, hey, charcoal takes up poison. So they started mixing serpivipacac with charcoal. The problem there was when they threw up, it was a really big mess because it was black. Then they decided, hey, let's just use charcoal. So now they just use charcoal in most emergency rooms for drug overdoses, for things like a poisoning. Okay, so if you take poison, you take charcoal. And people always ask, how much charcoal do I take? You take enough. And people are going to say, well, how much is enough? All right, here's a base rule of thumb. If you're taking X amount of charcoal, take 10 times X. If you take X amount of poison, you take 10 times X. So if you've taken, you think, one medication that you know is poison, or let's say you take a fly tablet that kills flies. Well, take 10 times the size of that fly tablet in charcoal. Myself, I take a whole lot more than that. You take as much as you need. You cannot overdose on charcoal. You might take 30 or 40 tablets. I remember one time I was in Romania, and I was going to be taking a night train to Moldova, and I'd spend a day with friends, and they had gotten some food for the cafeteria from me, and they just left it sitting out on a warm day all day long. I ate it just before I left, and then I got on the train. Well, that food had apparently picked up toxin, whether it was whatever the toxin was, but I got critically sick that night. I did not have charcoal. I went into the bathroom in the train. I tried to make myself throw up. I couldn't. As soon as I got to Chisinau, Moldova, I went straight to a pharmacy. Every pharmacy in Eastern Europe has charcoal tablets. I got 50 of them right away and took 50 tablets right away. So you take at least 30 to 40 if you've been poisoned. If that's not enough, you repeat the dose. 10 minutes later, 20 minutes later, if you still have symptoms. Many people have intestinal gas. If you have intestinal gas, one of the best treatments will be taking charcoal. Every time you take it, it's going to start taking up that gas. So you take enough tablets. If it's not enough, you take more tablets, or you take enough powder until it's gone. It's one of the best treatments for nausea and vomiting. Now, many people, if they got vomiting, they take charcoal, they're going to throw it back up. That's fine. You take some more, and you take some more until you're no longer throwing up from the whatever's giving you the problem. I had this problem once in India. Yeah, I'll tell you the story because it goes along with the diarrhea. If you have diarrhea, one of the best treatments is charcoal. Now, if you want to lose weight, the best weight loss program in the world is 2 drops of water from the Ganges River. Yeah, that will give you diarrhea, that'll give you nausea, and you will lose everything for a long time. I don't recommend you do this. But I was in India, and I was invited to a person's family's home at night, and we were talking, and then the lady brought into the room a large plate filled with grapes, freshly washed in their water. He gave it to me. I was the only one. And I told my translator, I can't eat these. You got to. I says, thank you. They washed them in their water. It's going to kill me. He says, you got to eat them. I says, it's going to make me sick. You're going to insult these people. So what do? Thank you. All right, grapes, all that water. I got deathly ill that night. But that trip, I had my charcoal. I was up taking charcoal all night. By noon the next day, I was perfectly fine. I knew another person, went there with his family. They were out in the city. They decided to eat. Now, one thing, if you go to India, I love India. I love Indian food. But here's a rule of thumb for people who are not from India. You don't eat it unless you washed it yourself, you peeled it, or you fried it. Because you don't go into a restaurant and eat a fresh salad because there's too much risk. And this family went into a restaurant, had a fresh salad. They all got E. coli. Problem was for the oldest, they had two little girls. The oldest girl, it went to her brain, and she stopped mental development right there. She's now a teenager, and she's still at 3 or 4 years old and very hard to control. So be very, very careful. Would charcoal have helped? It couldn't have hurt in that case. If you got the diarrhea, take the charcoal until you no longer have the diarrhea. And again, people say, how much? Okay, take a half a cup if you want. Take 2 tablespoons if you want. If it keeps coming, and some people say, well, how long between? Doesn't matter. It's going to help you. And it will take up the moisture. It will stop the diarrhea, whatever it is. We use charcoal in gas masks. We use it in water filters. It's amazing stuff. So the gas mask thing, let's say you've got I had a roommate in the academy. Man, did his shoes stink. I wish I'd known about charcoal then. Just put a little bit of charcoal near them. It'll take up all that nasty smell. But charcoal's become even more important here in Okinawa since Fukushima Daiichi happened, because it's putting out a huge amount. Matter of fact, right after the accident, the groundwater was measuring, well, matter of fact, I think I'm going to show you, iodine 131. In the water around the reactor, it was at 4,385 times above safe legal limits. But it gets worse. The groundwater that seeps down, it was 10,000 times above safe legal limits. Iodine 131 is one of the most carcinogenic of all radioactive isotopes. Iodine is what we need. If we don't have enough iodine in our body, we'll take iodine 131. And that's going to find its way into the thyroid, which is the thyroid hormone, is iodine. So let's say you've already got some iodine 131 in your thyroid gland. What can you do? I recommend people take charcoal tablets. You put them in your mouth at night. They will slowly dissolve. You'll be swallowing small amounts of charcoal all during the night. And as it passes down your esophagus through the thyroid gland, it will start to adsorb the iodine 131. Just like I mentioned before, it's going to take it up just like a magnet takes up the metal. In Germany, they're making air filters. Why in Germany? Because Chernobyl's not that far from Germany. They're making air filters that will take 70% of the iodine 131 out of the air. But it doesn't matter whether Chernobyl is there or not. Every nuclear reactor releases small amounts of iodine 131 and other radioactive isotopes, plutonium-90, all these different things. So we got to be very careful with ourselves. And that's one of the ways. We can use charcoals externally. I had a farm one time and I bought 3 horses, and then someone called me and they wanted to sell me a 4th horse. He'd already sold me one. I says, look, I've got enough. He says, I'll make you a good deal. I will sell you the horse, the saddle, the bridle, and I will deliver it for $25. Now, a person who knows anything about horses would have said something's wrong with the horse. But I thought it was a great deal, so I bought it. He brought it up, backed the trailer up to my gate, led the horse off backwards, and then he took off. because the horse had a very infected eye. I mean, it was so bad. Just weeping. You couldn't even see the eye, just sloppy, pussy, and everything else. I thought, oh, now what am I going to do? I used charcoal. I gave it internally, and I did large charcoal poultices externally. It got completely well. You couldn't even tell it had ever been sick. It was amazing. I was working on, this is Lakshmaya's foot. This is a man in India. They had told me the first night, this man needs to see you. He injured his foot. I thought, okay, injured his foot, not a problem. They didn't tell me he'd injured his foot 4 years before. This was the top. Apparently something went through his foot, and this was the bottom of his foot. Basically live flesh that it's grown abnormally there, and it was in bad shape, and used charcoal for him. Working in Zambia, this is a place called Shingoma. You'll see in the base of the hills in the distance there's a river. It's called the Kafui River. The Kafui River is full of hippopotami and alligators. No, crocodiles. Not America's got the alligators. Crocodiles. Well, a young boy and his cousin were fishing in the river. And the way they fish, they get into the river with a net. Well, a crocodile caught one young man. His name was Freddie. And his cousin grabbed his arms. They had a tug of war, and somehow he got this boy out of that crocodile's jaws. Well, an angel was in there too. They took him to a clinic. The clinic says, oh, crocodile bite, no deal here. You can't fix it. You're going to die. It's going to be so infected. Well, he went back home. That's him laying there with a towel over his legs. That's to keep the flies out of the wounds. The lady there in the white, she's lived there for most of her adult life. And she was very good friends with these people. That's me with a stupid looking hat on. But we would go over there. I'd take my students over there every 2 days. We had to climb a mountain, come down the other side of the mountain, across the plain to there to treat his wound. Now, there's no running water, no electricity, but we had to clean the wound. How do you clean a wound when you have no running water? Well, when I was in India with Lakshmaya's foot, I learned something very interesting. If you have a plastic bottle, you put a small hole in the plastic bottle, you squeeze the bottle, and you get a good jet of water. And so I was able to clean his wounds. Now, I wish I had a better camera to show his legs, but you can see that's a large tooth mark. There's a little one, a couple below there, but his whole leg was like that. We treated him with charcoal and herbs, and he got completely well. Then there was Lawrence. Went to visit Lawrence. My students were always looking for sick people. They found Lawrence walking one day with his crutches, and he had a dirty rag around his leg. And they said, "What's wrong with your leg?" And so they came and got me. They said, "You got to see this guy's leg." So I went there, and this is what his leg looked like. That little thing below his leg, that's the rag. It was a piece of a shatingi that he had wrapped around his leg. It was something that was eating his flesh away. He said it started one morning. He woke up, there's 2 sticks, he said, sticking out of his leg. And then it just started spreading from there. And that's what he had. It was nasty. So I taught him to clean his own wounds. I taught him how to make charcoal poultices. I bought him enough bandaging material to be able to dress his wounds. And that's what he did, and it got completely well. This old man in Moldova had this large venous ulcer on his leg. And it was so bad that he couldn't work anymore, and people who walked by his house would look away because he had some sickness. But my students got down every night on their knees, and they cleaned his wounds, and they dressed it with charcoal, and it got completely well. And the last night, the man with tears in his eyes says, "People won't even look at me, but you got down and you touched me." He got completely well, went back to work again. Then I'm forgetting his name right now. He was in Yanga, Zimbabwe. Francis, name was Francis. His sister came to me, she says, "My brother has a sore on his knee." I said, "No problem." I gave her, we had these charcoal patches. Here's enough for 4 days, morning and evening, change them, and he should be fine. Came back on the 5th day, she says, "No better." So I said, "Well, let's go see this boy." We went to see him, and this is what I saw first. He had this, I said, "That's a pretty big poultice he's got in his leg." And then I unwrapped this wrapping, and that's what the sore on his knee looked like. This was a large tumor. This is the side view. weeping, stunk. It was nasty. I took this picture about the 1st of December. 3 months before, doctors had removed it in surgery, and it grew back. Very aggressive cancer. Some of them are. So what did we do? Well, we dressed it with charcoal. Took care of the smell, took care of the pain, took care of the inflammation. But let me tell you a reality here. And I haven't taught anyone this trip this yet, but the number one purpose of a medical missionary is to get people ready to die. And if you get them ready to die, they're ready to live. My one student I had with me took a real interest in him. He was the same age. They're 18 years old. And so she took her own hardback copy of Steps to Christ and sat down and just talked with this boy. And she gave him his book. She says, you got to read this book. You got to know the Lord. And that's where we left him. And I got a word about 2 years later that he had died of this particular cancer. But our job was to get him ready to die. Because if he's ready to die, he's ready to live. The man with that big wound on his leg, he also died. Matter of fact, many of the people that I work with, they're going to end up dying because they're really in bad shape. But I always work on the soul first. If you get them ready to die, they're ready to live, die, or whatever. It doesn't really matter. So making charcoal poultices, which we're going to show you how to do. You just make charcoal. I like to mix some flaxseed with it and some water. You make a paste. You put it on a cloth. You cover it over the wound. And then you wrap it up with something that will keep it from leaking all over the place. I was working with a woman in Taiwan one time. And they brought her. They says she had been a patient there where I was working. And she had breast cancer. This is what she looked like. This is the center of her chest. And that smelled, and that was oozing and weeping and stinky and painful. And all we used was charcoal. And this was just a couple of days later. Look at the difference between this and this in a couple of days. But I'd spend 2 hours every evening talking with her about Christ. We had wonderful talks. She died a few months later, but you get them ready. I was... if you have, let's say, skin problems, you get poison ivy, you touch a lacquer tree here in Japan, it can cause real problems with your skin. Charcoal will take care of it. Bee stings, very good. Charcoal will take up the toxins from that. Spider bites and snake bites, very good for that too. Matter of fact, in America, we've got two very poisonous spiders. One's a neurotoxin, the black widow. One's a hemotoxin, the brown recluse. Now the brown recluse, when he bites you, it will start eating eating your body right down to the bone. This guy was bitten on the thumb. This person was bitten on the back of the neck. This person was bitten on the thigh. And the treatment of choice with a brown recluse spider bite is to cut the tissue away. And cutting the tissue away doesn't do any good because the toxin's still there. It usually, the end of the day, they end up cutting off your limb because that's the only way to stop it from growing. There was a woman, an Army captain at Fort Benning, Georgia, which we're very near. She had been bitten by a brown recluse spider. They eventually had to amputate her leg. We didn't know she was there. Charcoal will always take up the toxins and make you perfectly well. We have a fire in the South. It's not a native to America. It came from South America called a fire ant, which means when it stings you, it feels like fire. Well, I was working in my office one day, and I heard the side door open to the office building, and a woman comes screaming in, carrying a young child who had gotten into a fire ant hill. And that child was bitten. This is just not his foot. This child was bitten all over the body, except for the head. And I grabbed the child away from the mother, went in. We had a deep sink. I'm showing a bathtub here. I took the child, I filled it up with water. I dumped in a jar of charcoal. I put the baby in there with the charcoal and kept him in there for about a half hour. When he came out, there was nothing left on his body. All the welts, all the poison was out of his body. He was doing completely fine. So this is the Bible verse I like for this whole thing. God has chosen the foolish things of the world to put to shame the wise. And God has chosen the weak things of the world to put to shame the things that are mighty. That's 1 Corinthians 1 verse 27. So basically, God has given us simple remedies because He gets the glory. We don't get the glory, He gets the glory. Okay, so we've given you just a little bit of the theory and some practice. Now we're going to take a break, a 10-minute break, so you can sit there and do what you got to do. We're going to set up, and then I'm going to quickly show you how to do some of these treatments so that when you have to do them, my recommendation is take a note of the materials that we have here. When you get the material, when you see this, you need to get all these materials and put them in one place, in a tote somewhere, so when someone is sick, you don't have to go looking for the stuff. It's all right there. So we'll see you in about 10 minutes.
Said I am the first Precious Lord, take my hand, lead me on, help me stand. I am tired, I am weak, I am worn. Through the storm, through the night, lead me on to your light. Take my hand, precious Lord, and lead me home. When my way grows drear, precious Lord, linger near. When my life is almost gone, hear my cry, hear my call. Hold my hand lest I fall. Take my hand, precious Lord, lead me home. Take my hand, precious Lord, and lead me home.
Just a closer walk with thee.
Just a closer walk with thee.
Granted, Jesus, 'tis my
Just a
plea.
closer walk with thee.
Daily walking close to thee. Yeah, let it be. Dear Lord, let it be. I am weak, but thou art
Just a
strong.
closer walk with thee.
Jesus, keep me from all
Just a closer
wrong.
walk with thee.
Oh, I'll be satisfied as long as I walk.
Let me walk.
Let me walk close to thee. Just a closer walk with thee.
Just a closer walk with thee.
Granted, Jesus, 'tis my
Just a
plea.
closer walk with thee.
Oh, daily walking close to thee. Yeah, let it be. Dear Lord, let it be. When my feeble life is
Just a
old,
closer walk with thee.
time for me will be no
Just a closer
more.
walk with thee.
But guide me gently, save me, oh, to thy kingdom, kingdom shore, to thy shore. Yeah, 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 just a closer walk with thee.
Just a closer walk with thee.
Granted, Jesus, 'tis my
Just a
plea.
closer walk with thee.
Oh, daily walking close to thee. Yeah, let it be. Dear Lord, let it be. Let it be. Dear Lord, let it be. Dear Lord, let it be. Dear Lord, let it returning with thee. Thou changest not, thy compassions, they fail not. As thou hast been, not forever wilt be. Great is thy faithfulness. Great is thy faithfulness. Morning by morning, new mercies I see. All I have needed, thy hands have provided. Great is thy faithfulness, Lord, unto me. Summer and winter and springtime and harvest, sun, moon, and stars in their courses above, join with all nature in manifold witness to thy great faithfulness, mercy, and love. Great is thy faithfulness. Great is thy faithfulness. Morning by morning, new mercies I see. All I have needed, thy hands have provided. Great is thy faithfulness, Lord,
Okay,
unto
we are going to run live on internet. So if you need something, please get it.
for sin and the peace that endureth. Thine own dear presence to cheer and to guide. Strength for today, bright hope for tomorrow.
Half hour, 45 minutes.
Blessings are mine with 10,000 beside. Great
Son. Okay, we're back with you live from beautiful up in the windswept areas of Okinawa. And I've got my friend Marco here. We're going to do some demonstrations for you about simple hydrotherapy techniques. The first one is called a hot foot bath, which basically, that's the elephant gun of all these treatments. This one's going to pretty much fix anything that we're working on. It's more of a full body treatment. It takes a little bit more time, takes a little bit more equipment, but it's a very powerful treatment. So what we do is I'm going to do this as a hyperthermia treatment. So what I've done, I prepared the area. I put a blanket on the chair. Then I put a sheet on the chair because up sheet down first. Many people do that first. So I've got all my equipment hopefully ready. I've got some hot water. I've got some. Now this is a dry run. I'm not going to actually use water because if I was actually doing this treatment, he would be disrobed because he's going to do a lot of sweating. And I mean, it's okay to sweat in your clothes, but really more comfortable if you're not fully dressed. So I'm going to take the sheet and I'm going to wrap his body in the sheet. Now, it takes a big sheet. Go get in a single sheet if you got a king. So I like to take a large sheet so that I can completely wrap his body in the sheet. You want to get all the way up around the neck because you don't want cold air going down the neck. So I'm trying to get the whole body wrapped up in this sheet. Then you come back the other side. Notice I am surrounding also this foot tub down here. You try not to get the sheet down in the water. Sometimes it's going to happen, but I try not to let that happen. So now he's fully surrounded. Now you're going to take the blanket and you're going to wrap him up in the blanket. If somebody, like I mentioned in the first part of this program, let's say he was a nicotine person, he was into tobacco, if you do this treatment, when you get done, if you had a white sheet, it would be yellow stained. You will still have yellow stains on this because it's going to pull the nicotine and some of the tars right out of the body, which is a really nice thing. So now I'm wrapping up in the blanket. What's the blanket for? This will trap the heat that he's going to be accumulating in his body because his feet are going to be in hot water. Now, to even more protect, sometimes, especially if a wool blanket, it's a little bit irritating to the skin. So I have another towel, which I'm going to put around the neck for a couple of reasons. One, it's going to be more a cotton towel. It's a little bit easier on the skin. Two, if it's going to keep any air from going down because you don't want the person to get chilled. So now I've got him pretty much fixed up here. He's ready to go. Once that's done, now you're going to go down to the foot tub. I do not have his feet in there yet. I wanted to get him set up first. So the feet are there. Now, of course, I started the whole treatment out with prayer. And I've got water in here, but the water is a temperature, let's say about body temperature, maybe a degree or two above body temperature. And then you put the feet into the water. Now, this is a very nice foot tub because it's made for this. Matter of fact, it's got little places for his feet to sit down in there. If you get a real shallow basin, which most people use, you can't keep adding hot water because it's going to pour out. This, you got plenty of space. So I've got water maybe up to his ankles right here. I don't actually have it. This is a dry run. But once his feet are in there and he's comfortable, then I'm going to take hot water and I'm going to start, now I put my hand in first and I start pouring it next to the side of the thing and moving my hand so that I'm mixing the water. If you just go, you're going to burn his feet because this is going to be really hot water because you want to raise the temperature of the water in this thing because we're talking about Fahrenheit, at 99, 100 degrees is not going to give him much of a temperature elevation. But I want to raise this foot tub up to maybe 107, 108, 109 degrees. So you add some. Now, how snow? You just watch. What I do, you can do one of two things. You can ask him, is that too hot? He'll tell you. But you can also just watch the toes. Often when it starts to get too hot, this is what the foot's going to do. The one foot's going to go over there and sympathize with the other one. It's going to start rubbing the other toes. When you see that, you stop. Cover it off and wait a few minutes. It doesn't have to wait a long time. The body will get used to that temperature. Then you uncover it again. You add some more hot water until the toes start doing the little dance again. You keep raising it up until finally you say, that's probably hot enough. Now you can have a water thermometer which will work. You might take it up to, let's say you decide I want it to be when I do hyperthermia, I'd go to 111. But some people cannot handle 111. You just want it to get, when you put your hand in and say, yeah, that's pretty hot. All right, then you're done down here. Your body's going to be warming it up. Now what you do, you always want to keep the person comfortable. You talk to them. I used to sit there and sing songs with my patients. You know that they're really hot when they stop singing. But here's what I also do. While they're there, every once in a while, I'll just touch their head. Just briefly touch their head. What I'm feeling for is sweat. When I feel sweat, that means they're in what's called heat dissipation mode. that means that their body temperature is going up. Now, see, he doesn't have a fever. I am giving him an artificial fever. I'm giving him hyperthermia. And as his temperature goes up in the body, it wants to cool it back down. And as I explained when we were talking about hydrotherapy physiology, when the body wants to lower the temperature, it sweats because the sweat will evaporate, taking away those 533 calories of heat. So once he starts to sweat, you want to keep him comfortable. So I have another container that's filled with cold water. Usually I even have ice in it. So I will take the cloth and I will keep their head cool. Now, when I teach my students, it's hard to get, sometimes they'll just go, that's it. They'll just do it one time, the person cooks like a turkey. Or they'll do like this. They'll put their cloth in the cold water, and then they'll take it and they'll wring it like a chicken's neck. Yeah, you get every last drop out, and then by the time it gets here, it's warm. You want it to be cold. So I say, put it in the cold water, give one squeeze, and then go the head. And I even do the face, go all over the head. It feels so good. Now, that said, some people do not want a lot. Some people want a lot. That's the boss. I'm not the boss. He's the boss. Does that feel all right? Oh, it feels great. Yeah. Hey, it feels good, doesn't it? And you just keep on going like that. I've had some patients the whole time you're working, you're doing this. Now, I will also periodically take their temperature. I usually start with taking their temperature, and after a while, usually 5 minutes, I'll take the temperature again to see if I'm going to get a temperature elevation. Because if they're sweating, it means the temperature is going up. That's why they're sweating. I will also, and you have to do this, as you're giving the treatment and they're sweating, you've got to replace the water that they're losing. So you give them drinks of water. I find it best to use a straw. It's really hard when you're confined like this to sit there and have someone hold the cup and pour it in your mouth, because then it goes up your nose and you got other problems. So you have them just drink the water. What's the temperature of the water? It's tepid water. If it's cold water, that has a negative effect upon the body when you're hot. So it's best to have lukewarm, room temperature water, and you just keep giving them water, and so that they stay well hydrated. And that's all you do. You got the feet in the hot water, their temperature's rising. Now as we discussed in the theory, what's happening in the body? Well, since they've got their feet in hot water, you're going to have more blood going down to the feet, which is going to relieve any congestion in the head. They say he's got a headache, he's got a chest congestion, he's got digestive problems. It's going to help that. But also, you're heating the whole body, which means you are mounting a good defense through your immune system. When the temperature goes up, white blood cells increase. When white blood cells increase, they're going to fight whatever it is causing you your sickness. When would you use this treatment? I would use this treatment for somebody who has influenza, who has a common cold, who has bronchitis, who has pneumonia, who has cancer. There's many different ways and reasons to use this. But I guess it's more important, when would I not use this treatment? When a person is got something wrong with their circulation, they've got diabetes, especially insulin-dependent diabetes, they got Berger's disease, something that they don't have good circulation, they don't have good sense of feeling. You wouldn't do this on a person who's unconscious, someone who's paralyzed, because they just can't feel it. Otherwise, it's a pretty safe treatment. Okay, so I'm keeping the head cool. I've got plenty of hot water down there. I might want to add a little bit more. People will say, well, how long will you do this treatment? You can do this treatment for half hour, 45 minutes to an hour. Doesn't really matter. As long as they're sweating, if you are detoxing the body, the longer, the better. And basically, keeping the head cool is more for their comfort than anything else. Yeah, it might help keep the head from getting, the brain from getting too hot, but they got a bone here, and not too much of that cold is going to penetrate the bone. So basically, it's going to be just so that they feel like they can stay there a little bit longer. And some people, when they start to get hot, they want out of here right away. So I've heated the feet, which has heated the whole body. He's sweating. His immune system's stronger. I'm keeping him hydrated. And sometimes when a person's in this situation, they might start to hyperventilate. I haven't had that ever happen to me, happen to a patient in this treatment. I have in a hot bath. Paper bag over their face, and they breathe into the bag. When you hyperventilate, you're increasing oxygen too much. It makes you dizzy. You breathe into the bag, you're breathing carbon dioxide. It lowers your oxygen, and you come right out of it again. You ask them how you feel all the time. You communicate with your patient. He's the boss. And once you feel like, all right, he's been here long enough, when you do a treatment like this, especially a good hyperthermia treatment where you've heated the body, you want them to rest when you get done, and at least for an hour after the treatment. Now, I can't take him, unwrap him, and go put him in bed unless he's got a water bed, because if he doesn't have a water bed, he will have a water bed because he will continue sweating for a long time, and he'll sweat through all of his blankets and his sheets and his mattress. So what you want to do before you start the treatment, you have prepared an area for him to rest. Matter of fact, on an artificial material couch like Naugahyde or even leather, you just put a sheet on it. Lay him on the sheet, fold the sheet over, let him rest for the hour. And it's very, very good because the immune system is still working very hard, and that will help. When you take him out of the hot water, you want to put his feet, dry his feet, and put him in slippers. You don't want him walking over a cold floor. Now, usually when I finish this particular treatment, I've cooked him as long as I'm going to cook him. I expose his feet again. What I will do is I will raise his feet. No, I got him. I can just relax. Just relax. There we go. I got you. So I raise his feet, and I take the cold water, and I pour the cold water on the feet. Now we got derivation. We've got a fluxion. Now you've got the constriction, but as soon as I quit pouring, you got the dilation again, which is very good. Then I dry the feet. I put on the slippers, and I take him to the area where he's going to rest for the hour after the treatment. Very simple treatment. Immune system's been rallied. It's stronger. He's gotten a good sweat going. He's detoxified. When I just mentioned tobacco. People have all kinds of toxins in their body. We should all, many people go to onsens. They go to saunas. That's a very healthy thing to do. I come to Japan for 2+ months every year. The last night, I'm to the onsen. There's one particular room. Now, this is another treatment I'm not going to demonstrate, but after you've had a good sweating treatment, finish it with a salt glow treatment. How do you do that? You've got some salt in there, not just table salt, usually more coarse salt, the kind they use to pickle pickles with. It's a little bit bigger grains. You add enough water so that when you put your hand in it sticks. So what you do is you get some of that salt in your hands, you start down at the leg, and you go up the leg. You keep adding, and you go all the way up the leg. You're going from the distal to proximal. You're always working towards the heart, both legs, both arms, back and front. There's an onsen I go to that there's one room, it's a sauna room, but there's a great big basin of wet salt. You grab handfuls, you sit there, and you're scrubbing your skin the whole time. That takes all the toxins that you just sweated out of your body. It also exfoliates your skin, these dead skin cells, any toxins on the body. It's fantastic. And when you get done, it's amazing. You touch your skin, it feels like baby skin. It softens your skin. It's one of the most pleasurable things that I do when I'm doing in that sauna. Okay, so we finished the hot foot bath. We're going to let him take a rest, but not going to let him take a rest because we got other things to demonstrate while he's sitting right here in this chair. So we're just going to unwrap the gift here. Yeah, you got a little bit hot underneath there. Yeah, you don't need hot water in Okinawa. You just need to get a sheet on you and a blanket, and that'll do it to you. Okay, so we talked in the theory part a lot about what we do for the head when we got different types of head problems. one of which is a nasal irrigation. Now, I'm not going to actually have them do that because it's something you really don't want to do in front of public. But here's what you take. You get a pint of warm water. This is a 1 pint jar, or 500 milliliters, a half a liter. Doesn't matter how you're going to do it. That little bit of a difference doesn't make a big difference. Then you take 1 teaspoon of salt. You put the salt into the warm water. You mix it up. That is saline. If you've gone to the hospital and you've been dehydrated, they put an IV in. They're putting saline into your body. Basically, a salt water at that particular level of salinity or of salt. And what you would do then, if he had a nasal congestion or an infection, I would have him inhale or to sniff this water up a nostril. You can do both nostrils. You go one at a time. Matter of fact, I've even taken, hold the nostril shut, put it into the water, and just breathe it up. Promise you won't drown. It's not going to go down in your lungs. It's going to come out the other side, but I'm holding it, so it's going to go down in your station tube, and then you can just spit it out. So you do it that way. Or you can sit there and put it in a spoon and snuff it up your nose. It's very, very good for any type of sinus problems. It's going to get up into the sinus passages and clean all that mucus out and make the lysozyme a nice house to live in to help fight the problems you're going to be having. Okay, another problem that we can deal with the face is what we call a nasal steam inhalation. So I'm going to sort of set it up here. I've got a glass bowl, and I like to use glass bowls for this. And what you do is you put some boiling water, and hopefully the water that I've got in the stove is boiling by now.
Oh, yes.
And if I can get some of that. And I've got some eucalyptus oil. Now, eucalyptus oil is one of the best oils for this. Eucalyptus oil, as you all know, is very good for your lungs and your nasal passages. Okay, so you go ahead and just pour some of that in there. Yes, you see the steam rising up. Now I'm going to put a couple of drops of eucalyptus oil in there. That's good, thank you. Okay. Ooh, that's a good one. Now I want you to lean forward, and then I'm going to put a towel over his head to catch those vapors, and he's breathing that warm vapor full of eucalyptus. How's that feel?
Good.
Yeah, smell good too, doesn't it?
Open this right up.
Yeah, it opens it right up. It does. It's just going to break it, open up. The heat's going to help open it up, and the eucalyptus is going to help open it up and go right down to your lungs. Is going to help the entire bronchial tree, the whole respiratory system. And you can basically, now, like I said in the theory part, some people use a pulley pot that's boiling, but that's just too hot. This will stay steaming. It's going to keep putting off that eucalyptus oil for quite a few minutes. Then if it gets not enough, add more hot water and breathe it again. Now, if you want a longer treatment, here's what I recommend people do. You take the eucalyptus oil, put some on your finger, and dot it on the person's pillow. They're breathing it all night long. When I'm in countries like when I was in Zimbabwe, people had problems with their lungs. I would go to a eucalyptus tree. I'd pick all the leaves, a bunch of leaves off, put them in a pillowcase, and use the pillowcase, that as their pillow. And so now they're breathing and of course you've got to crush the leaves to get really the essence to come out, but now they're breathing it all night long. So basically you can use eucalyptus, which is good for the lungs. You can use pine oil, very good for the lungs. You can use lavender. Let's say a person they need a sedative. Lavender is a great sedative. Just learn some of your essential oils, and all you got to do is put it in the hot water, and it's going to come up. And yeah, we got to dry his little face off here. Yeah, it's so simple, and it feels so good. It's so good for the lungs, so good for the nasal passages. Okay, another one that we can do. Let's say my brother has, let's see, he's got a sore throat. Okay, I'm going to take a cloth, put it in cold water. Okay, usually just one layer is fine. I'm going to put the cloth around the neck. Usually got a safety pin to hold it, but this is going to be fine right there. Now it's cold, and that's going to cause the initial action of vasoconstriction. Then I'm going to take a piece of plastic, and I'm going to take the piece of plastic and I'm going to cover that particular cold piece of cloth. Now what's that for? Two reasons. One, it's going to trap the heat because it's going to have a hard time getting through the plastic, and it's going to keep from getting everything else in the area wet. Now I've got a long piece of plastic here, but I'm just going to use the whole thing. Wrap it around there so the cloth is not exposed, so it's not going to wick the water out. And then on top of that, you take something that's thicker. I usually like to use a scarf. Another good thing to use is a thing called a dicky. Now you don't see dickies anymore. A dicky is basically a turtleneck and just a flap in the front and a flap in the back. You wear it as an artificial turtleneck sweater underneath another sweater. And I've got a few of these. I go to thrift stores. If I find them, I buy them because you put the dicky over this, which looks pretty like now you're very stylish. But if you take something that's heavier and you wrap this around all of that, now you've insulated it even more. It's not going to give up its heat. It's going to hold all the heat that the body's generating, because now, first, remember I said, when you put in cold, you got constriction, but then as a reaction, it's going to try to warm the area up. Now you've got dilation, and you got more blood going to the area, but it can't escape. The heat can't escape because you got this on there. So now you've raised the heat in this area. So you're going to have more white blood cells here. You're going to have oxygen here. You're going to have more nutrients here. Great for laryngitis, you can't talk, or you've got a sore throat or tonsillitis, whatever your itis is, you put this around your neck. And I usually do it at nighttime. In the morning, you remove it, you do a frictioning with cold water, you dry it, and you wrap something warm around your neck. It's fantastic. Now, let's say it's not your throat that's giving you the problem. Let's say it's some other part of your body. Not a problem. You can put this on any part of your body. I could put this around his elbow, okay? Same thing. But let's say he's got a cold coming on. You don't have time to do a hot foot bath. You don't feel like doing a hot foot bath. But I want to do something that's going to give him some derivation. I want to send the blood down. Very simple. I'm going to give him a heating compress to the feet. How do you do that? I get a pair of socks. I like to get white cotton socks. You put them in the cold water, okay? Then I'm just going to do one foot. Put it on the foot. It's been a long time since This guy's got big feet.
My feet are not big, so you know.
He's got little socks. Maybe that's okay. So I've got this cold, wet sock on his foot. All right. Next thing I'm going to do, I'm going to put his foot in a plastic bag. Okay. Hey, that fit much better than the sock did. Then I'm going to take another pair of socks. And usually I like to get a big, thick pair of socks, some big wool socks, but this will work fine. And then I put these over the foot. And I do this at nighttime before the person goes to bed. Now, I put on the cold, wet socks. Constriction, then dilation. Now the blood starts coming down to warm the area, but the heat now cannot escape, and so it's going to stay dilated. You're going to have more blood down here, which is going to act as a mini hot, as well as being derivative from the head, the chest, the abdomen, or the, and cause more blood down here, relieving congestion. Problem with this: if a person is got a little bit or really very prone to athlete's foot, being a fungus, likes three things. It likes dark, warm, moist places. That's what this is, a dark, warm. You do that cold water, you were going to put a little bit of vinegar to it. Okay? Like acid, the pH of vinegar is 2. So now you put a little bit of that in there and you put this on. Now it says no fungus allowed. In fact, vinegar is very good for treating athlete's foot. When I'm in the summertime and wearing sneakers a lot, I will get athlete's foot. If I, morning and night, just put my fingers, I have a special jar, special jar of vinegar, and I put it between my toes, wipe my feet down. I never get athlete's foot because I not like it. Okay, what other little treatment can we do here? We're going to show you about how to use charcoal. I'm trying to think if there's any other treatment that I can work with here. We've done the heating compress. Now the heating compress also, you can do it on the chest. And here's how you do it on the chest. You can take a t-shirt. What I like to do is cut the sleeves off of a t-shirt, put it in the cold water, put that on the person. Then get a large garbage bag, cut a place out for the head, a place out for the arms, put that over the body. So now he looks like, he's going to the garbage dump. And then you put a sweatshirt or a sweater that's a little bit tight over that. Now he's got a heating compress on his whole chest because, see, the lungs are affected from the front and in the back. So now you're going to be taking some, first of all, you're going to bring in blood to the surface because first you had the constriction, now the dilation. You're going to have decongestion in your lungs and they're going to breathe easier. It's great for anything like, pneumonia or bronchitis, bronchiectasis, whatever the problem is, it's going to work very nice. If you've got coughs going on, very nice for the cough. So these are some of the really basic, simple hydrotherapy techniques. And you can use it anywhere. And I mentioned, the other one I mentioned was the contrast bath. That's right, I'm thinking contrast bath here. All you need was the 2 containers of water. Doesn't have to be fancy, just 2 containers of water. Let's say he's got arthritis, very painful arthritis. You put your hand in the hot water. You leave it in there for 3 minutes. After 3 minutes, you go over and you put it in the cold water. Okay? When you put it in the cold water, you add more hot water over here because now your hand has become adapted and it's going to feel really good going from the cold back to hot, but you want a little bit hotter. Let's go 3 minutes, 30 seconds. 3 minutes, 30 seconds. Now I showed you in the picture doing it with a snorkel, putting your face, you can put your whole head in the water if you have a snorkel, because we snorkel with our whole head in the water. You're breathing air, you've got your heat going on, you got your cold going on, you got that good fluxion. Fluxion means in and out. Now what does fluxion do? What he's doing right here, you got dilation, you got constriction. You got dilation, you got constriction. That is strengthening the musculature of your vascular system. So now you're making your vascular system stronger because you're exercising the vascular system. Sounds like a pretty simple thing to do. And you just did it with 2 things of water, hot water and cold water. See, the nice thing about these treatments is you can do them anywhere, anytime, with anybody, within restrictions. There's some people you got to be careful with because of the fact that they don't have feeling and they've got, not good circulation. But other than that, it's a pretty safe treatment. Okay, now, I'm good with you. I'm going to show them how to make a charcoal poultice. We'll leave that there because I'm just going to sit in this chair like I'm getting a hot foot bath, and I'm going to make a charcoal poultice. Now, what do you need for a charcoal poultice? First of all, you need charcoal. I like to have charcoal powder wherever I go, but I also always carry my charcoal tablets with me because you're not going to carry charcoal powder on the airplane. It looks like gunpowder. I don't want to sit there and spend any time in a jail. So I'll carry this in my luggage. But you got to be careful in the luggage. You got to make sure it's really, really well sealed. But even that could be a problem because sometimes the TSA looking at what is that stuff, and they open it up and they spill it, and now you got charcoal all in your suitcase. So anyway, charcoal. There's another kind. This one it says charcoal powder. Sometimes when I'm carrying something that looks suspicious, I write a note to TSA. TSA, this is what this is. It's not going to hurt anybody. And maybe they'll listen, maybe they won't. Is this also charcoal powder? Okay. Okay, so you also need a spoon because we're going to mix this thing up. Something to make put the charcoal poultice in or make the charcoal poultice out of. And then you need flaxseed. Flaxseed powder, not the whole flaxseed. You need flaxseed powder. So here's what you do. And you got to be careful, especially on cold days, which this is not a cold day. When it gets cold, it gets more static electricity. And I've seen people, we're in a church in somewhere out west in the United States, and we were selling stuff, and we had this big pile of charcoal containers, and somebody wanted to open up to see what it looked like in the church lobby with this beautiful red carpet, and they spilled charcoal all over the carpet. One contraindication about charcoal, it stains. It really stains bad. I worked for about 4 hours to get that thing so you couldn't notice it anymore. I could notice it because I knew where it was, but it was a mess. So you've got to be careful with this stuff. If you cut it on your clothing, it will stain your clothing. But another good thing you can do, take the charcoal powder, get your toothbrush wet, dip it in the charcoal powder, and brush your teeth. It whitens the teeth. You can also take the charcoal powder, mix it up with Elmer's glue, that white glue that that it smells like sour milk, because there probably is milk in there. You mix it together until you make a nice cream, and then you can sit there and paint it on your face. Paint this stuff on your face. You don't do this with everyone watching. And then when it's dry, you peel it off. It takes all your blemishes out of your skin because the charcoal made them come out of your skin and they get stuck in the glue. When you pull this mask off, it takes all those blemishes with it. It's a pretty nice idea. So I just put 1 spoonful of charcoal powder in here. I'm going to put, maybe an equal amount of the flaxseed powder in here. Why we use flaxseed? If you've ever mixed flaxseed with water, you will notice that it has a tendency to become mucilaginous. It sort of holds moisture really nicely. And so when we mix it, and I'll show you what this looks like when we get done, it's going to make a very nice paste. If you just use charcoal and water, that's fine, but it dries very fast. I was once working with my grandmother. She was 93. She was having some eye problems. So I says, Grandma, let me try this. And so I mixed up some charcoal with water, didn't have flaxseed, and I made a poultice, and I put it on her eyes, and I said, sleep on this. She woke up in the morning. She was mad at me. Why was she mad? Because the charcoal had dried and gotten on her nice white pillowcases. But she never had eye problems again. Never. She died at 96. Doctors gave her the wrong medication. So basically, this is a great thing for eyes. I've known people with glaucoma and other problems, I forget the other eye problems, but putting charcoal poultices has even reversed those type of problems, macular degeneration. Now, I'm not going to say it's going to work every time, but hey, what does it hurt to try? I mean, it doesn't cost any money or much. You got to buy the charcoal, I guess. It's not going to hurt your eyes. It's not going to hurt anything. So my recommendation is, no matter what the problem is, you give it a try. Now, one thing about mixing up charcoal, it doesn't like to mix with water at first. You got to keep working until finally it starts to turn into that kasha, that's Russian, starts turning into a oatmeal-like consistency or just a nice jam consistency. Don't add too much water, because if you get too much water, it's going to be too dry. It's going to be too moist, and you got to add more charcoal. I'd rather be in this situation where I've got to add more water. But you add just tiny little amounts at a time, because you can go, it's sort of like you got a 3-legged stool and it rocks, so you cut a leg off a little bit and it rocks, and then you cut another leg off a little bit, and pretty soon you're sitting on the floor because you just couldn't get it right. So you add a little bit at a time, and this is getting pretty nice. I'm going to do just a skoshie more. There we go. That's good stuff. Okay. Yes. So like a cow. Okay, now what we do is we take our material that we're going to use for the poultice. Paper towel works fine. Cloth, fine. Even better, hospital chucks, if you can find the chucks. Because a hospital chuck, it's got a plastic layer, you've got a absorbent layer, and then you've got a mesh layer. And so basically what you would do here with the hospital chuck, let's say this is a hospital chuck. It's got 3 layers. You've got your water resistant area. You've got your mesh. You would lift the mesh up, put the charcoal in here, close it down. Now it's on the absorbent area, and you put that on your skin. Well, we're just going to use a paper towel. I'm going to take my charcoal solution and just plop it right there on the area. This is probably a little bit drier than I would like it to be, but this is going to be fine. You spread it out. This is what I did for that horse I had out there in Missouri when I lived in Missouri. And then you fold it over. And you apply that to whatever the problem is. They got a bee sting, they got a snake bite, they got a spider bite, they've got blemishes, they've got an infected wound. Infected wounds, it works great. It takes up the infection. It has an ability to take up the toxins out of the skin. You put that right on the problem, and then you would take that piece of plastic that I had a minute ago, and you wrap it up in plastic to keep it from getting to get too dried out and start to dry up and flake out. And you can keep that on. Well, let's say you get bit by something that's very venomous and you're very allergic to it. You would change it about every 5-10 minutes because it's going to be pulling toxins. Now, let's say you get bitten by a snake, a habu out there grabs hold of you, and they're bad snakes. My recommendation would be you get a bucket of water and you put charcoal in the water and you immerse your limb in the water and then put a poultice over the bite itself, and then you start taking charcoal internally. Because basically once that toxin gets into the bloodstream, it's going to go all through the bloodstream. Well, you've got the villi in the intestinal tract, in the small intestine. They're very vascular because that's how it takes up the nutrients. The charcoal goes through and the blood's going through and it's going to pull that venom right out of the blood going through as it goes down your intestinal tract, and you're going to be taking up toxin through your stomach and through the water and the poultice, and basically you're good to go. My recommendation for any snake bite, if you can't get an antivenom, is you use charcoal. Otherwise, it could be really bad news for you. So that's the basics of these treatments. It's very simple. It's very quick. If you have any questions, I gave email address yesterday. I'll give it again today. It is, a matter of fact, it's going to appear on your screen here in a moment. But you can write me, and I can give you whatever, and I can even give you a resource here in Japan for getting charcoal. But as I mentioned before, and I'll mention again right now, you can make your own. Matter of fact, just taking the wood, matter of fact, I look at here right now from the typhoon that went through, there is broken trees everywhere. So take some of those broken trees, cut them up into pieces, let them dry, and then build a fire sometime, put that wood in there, get the fire, get them in the coals, and then stop the air from getting to the fire. Put a bucket over them, a metal bucket, and it's going to stop the air, and the coals, rather than turning to ashes, become charcoal. That's going to be your charcoal. Bamboo makes very good charcoal. Any tree that's low resin makes good charcoal, like willow trees. A lot of resin, like pine trees, not so much. You make charcoal, it still smells like a pine tree. You want to get just carbon. That's all you want in these things. So that's basically my email address, worldmighty@hotmail.com. You can write me anytime, like I warned you yesterday. I get lots of emails, so you can ask me a couple of times sometimes. But I can send you counseling sheets. I can give you suggestions to help you become a good practitioner of simple remedies in your home. Everybody should be a medical missionary. Everybody should know these simple things. Let me just give you one last story. I think it's going to be one last story. I injured my back very badly in the Marine Corps, and to the point where it was sometimes almost debilitated. When I was out of the Marine Corps, I was working at Uchee Pines. I was working in my yard one day, double digging a garden bed, and I hurt my back bad. My little girl lived with me. She was probably 6 years old. She helped me into the house. She helped me lay down on the bed in the house, and I was really in pain, laying flat down in the bed. And then I heard her leave the house. She came back in about 15 minutes later. She came into the bedroom, climbed up on the bed, and she had a plastic bag in her hand filled with ice. And she just put the ice in the middle of my back and started moving it around my back. That's the best thing in the world for that type of a problem. When you hurt a muscle, when you sprain or you strain something, ice is the solution. She rubbed my back until the pain subsided, and I went to sleep. I woke up early in the morning, and I was still laying in the same place. I look off to the side of my bed. My daughter was lying on the floor next to my bed in case her patient needed her. 6 years old. Anyone can do it. We just have to know some basic principles, and then we got to get out there and we got to do it. I hope some of these things helped. I hope it's a blessing. Are there any questions we've gotten on any? I don't see anyone with any questions. Yes?
On the horse's eye, how did you hold it?
Okay, good question. On the horse's eye, how did I hold it? Well, first I made a poultice just like this, a little bit larger, but then I had an old, and they weren't mine, I had an old nylon stocking. Nylon's very stretchable. And I split it, and I wrapped that nylon stocking around the head so it held it on fine. Now, you might also wonder, how did I get the horse to eat charcoal? Very simple. I had a big stainless steel bowl. I mixed charcoal with water and flaxseed. I chopped up an apple, added that, and I added some turbinado sugar. And then when it got to the right consistency like this, I'd grab it and I'd make big balls. The horse thought it was jelly beans. And I was feeding the horse the charcoal, putting charcoal on his face. It got completely well. It was amazing. The guy really cheated himself out of a good horse because $25 wasn't bad. No, he cheated himself out of 2 horses. As soon as he got well, it wasn't a he, it was a she. She had a baby. Yeah, bonk, right there, bonk, had a baby. I didn't know it was, I don't know much about horses, not a veterinarian, but didn't know I was pregnant, but here we had a foal. So now I had 5 horses. Yeah, simple remedies. Yes, sir.
There's a question here. What are the 2 books about hydrotherapy?
Okay, one was Home Remedies by Thrash and Thrash. The other one, I'd have to open my computer. I just ordered it myself. It's waiting for me back in Alabama. It's basically hydrotherapy for massage therapists. I'm pretty sure that was the name of it. It's very close to that. Well, since someone's asked me the question, let me just get my computer just to make sure. Screen on. Whoa. Okay, here's another one. This was Dr. Agatha Thrash's last book. As a matter of fact, all the years I worked for her, she was working on this book. This is called Nature's Healing Practices. This is not Home Remedies. This is one of her first books. But this was her, matter of fact, she died before this one came out. And it is, and she wanted it to be this way. It's an encyclopedia of natural remedies. It's just amazing all the things she has in here. Pain control, autism, schizophrenia, hot flashes, hormone replacement therapy, impetigo. There are so many different treatments in here, and what you do, what causes them, and what medical science says about these things. And that's what we're looking for, is it validated by medical science? And yes, it is. Okay, here's the 2 books I recommended. Modern Hydrotherapy for the Massage Therapist. You don't have to be a massage therapist. It's going to give you the physiology of hydrotherapy. And I'm looking forward to getting home and reading it. because I need to know more about this, because this is God's way. He made the water, and He's also going to make a way for us to find those miraculous treatments by using His simple ways. Any other questions there? Any other questions from anybody?
About sore throat, did you say warm water or cold water?
Warm water for sore throat. Matter of fact, I didn't mention all the things for sore throats. There's a few things you can do for sore throats. One, gargle with warm salt water. Very nice. Salt water is very, very healing for the throat. So you make warm water, spit it out. You can also use charcoal tablets. If I get a sore throat, I'll put 2 charcoal tablets both sides of my mouth at night, and it'll be bathing in charcoal, taking up the inflammation at night. So those are some of the things. You can also use lemon juice, eucalyptus, and honey. Very good for sore throat and for coughs. Just taking small amounts of that. So yeah, those are some good things for sore throats.
We do have another question. The question is from our listener is, what kind of doctor are you?
I'm a naturopathic doctor. And some would say, what in the world's a naturopathic doctor? Allopathic doctors, which are great, they do wonderful things. They're basically pharmaceutical based. They got a problem, you treat it with a pharmaceutical. A naturopath is basically treats it with natural things. We try to stay away from pharmacology. But here's our philosophy, at least why it's my philosophy. If you have to take medications, which sometimes you do, it's an admission you do not understand physiology well enough. You don't know how to fix it with natural things. I believe there's a cure for every disease. We just haven't found it. I have used medications. We've used medications at UT Pines, but it's a very rare thing that we do. We want to try to do everything natural as possible, because with natural means you don't have the adverse side effects, and that's what we worry about. If you look up 2 words, nosocomial and iatrogenic. Nosocomial means basically, I don't know why we died, but we died. The other one, iatrogenic, basically reactions to drugs, reactions to procedures that we have. And basically those 2 things together, iatrogenic and nosocomial, are between the 3rd and the 4th and 6th leading cause of death in the United States today. It kills many people, mistakes that are made in hospitals and reactions to medications. I've lost a couple of relatives, just their reactions to the medications. So I'm not against them. We use them when we don't know what else to do. I'm a naturopath.
Our same viewer asked, where did you go to school to get your degree?
Southern. Okay, I was going to Southern Adventist University. The Southern. Now I'm forgetting this thing right now. The Southern Graduate Institute for Alternative Medicine. This has been so long ago and is no longer functional. Matter of fact, one of the largest naturopathic schools was not John Bastyr. It was, I forget the name of it. It was in Alabama. It's closed down too. Schools come, schools go. My school came, my school went, but I got the degree there. I mean, this has been a long time ago. Yeah.
Dr. Miller, have you ever used 100% pure turpentine to address problems with parasites or anything like that?
No, I have not, but I've heard people doing it. But I have not used pure turpentine myself. It's a very concentrated thing, and I do use pine sap for external problems. And basically, pine sap is turpentine when it's solidified. It'll heal anything outside. As far as inside, no, I've not used it internally. For internal parasites and stuff, I'd rather use things like diatomaceous earth or pumpkin seeds or garlic or artemisia. There's other things you can do for internal things that might not have as much of a possibility for adverse side effects. Okay, yes?
My question is about your lemon water. Does that not create a problem of something between meals besides water?
Okay, lemon water. Well, I was very thirsty and a little sore throat, and basically There's not a whole, all right, there are some nutrients in the lemon. I'm not eating the lemon. I'm not getting the fiber. It does not need to be digested. It's just water. It's not a whole lot different than drinking an herbal tea. I'm just getting the essence from the lemon, some oil in the rind, which is going to be very good for my body, but not cause any, my body doesn't have to mount up a digestive system to be able to deal with anything that needs to be digested. So it's not a major problem. Fiber has to be, well, fiber is indigestible, but the fiber is going to be attached to other things that need to be digested. This has nothing digestible in it. I mean, there may be some, there's going to be some vitamins in there, but not a whole lot of carbohydrate or protein that needs to, or no fat. Well, there are some essential oils in this rind, but not enough to make a major reaction for a digestive system, no.
Question for you. Under the home remedies or natural remedies, what's your thought about the use of herbs?
Herbs, I major in herbs. Herbs are so vitally important. And, you know, I think I was thinking about putting something of that in here, but I knew that we'd be running short on time. But first of all, here's what I recommend. Learn the herbs in your area. If you lived in Okinawa, I'd look for an Okinawan herb book. No sense looking for an herb book from somewhere that you don't even have those plants. But you've got your own plants here. Now you learn what they're for, what are the indications, why would you use these things, how to prepare them, what part of the plant to use, what's the best time to, we call it wildcrafting, what's the best time to wildcraft, to gather that particular plant. Some plants, you got to be very careful. There's a plant called an oleander. If you take an oleander, let's say you break off, they got these nice willow sticks there. You take off you cut the stick, you put a hot dog on there and you roast your hot dog in a fire, you eat your hot dog, you're dead. It is so poisonous. So we got to know what the plants are. Every plant is not good for you. But there are some plants that are fantastically powerful medicines. As a matter of fact, there are about 250,000 different varieties of plants in the world. Less than 1% have been studied. From that 1%, 25% of our drugs today have been synthesized by what they found in the plant. And my recommendation is just stay with the plant. Why do you have to synthesize it? Because when it's before it's synthesized, the healing properties are there, but also the protection from the just that one element that caused the reaction. In the northwest of the United States, you got a thing called the Pacific yew, Y-E-W tree. It is a natural chemotherapeutic agent, but taking it by itself is not going to make your hair fall out and kill your immune system. But what they've done, they synthesized what's in the Pacific yew, and they made a chemotherapeutic agent which makes your hair fall out and kills your immune system. So my recommendation is we go to the way God packaged it, and it's a whole lot safer and a whole lot cheaper for the body. Aspirin's the same thing. Aspirin comes from, the word aspirin. Aspirin comes from aspen and spirane. It's a type of a flower, a meadowsweet in Europe. Aspirin. That's where they got it from, the two plants. They saw that these native people were using these things and they helped. They synthesized what was in there. They made an artificial aspirin out of it, and now we've got aspirin, which is exalfatoxin. Causes much liver damage.
This same viewer again is asking about the throat treatment that you performed earlier. Could you explain briefly the cloth? Was it hot and cold?
It was cold. See, we call it, that's a good question. Most people get confused. We call it a heating compress, but we put cold on the body because you're not going to get the heat there if you just put heat on there. If you put a warm cloth around your neck, it's going to cool off. This is going to be a warm cloth around your neck. If you put cold, you're going to have an initial reaction to cold is constriction. But the body says, no, we got to warm the area. Now it's going to cause an overreaction of dilation. That's why when you rub yourself with ice, after a while it turns red. And you keep on wanting to turn white, and then you get frostbite. But if you put the cold on there, constriction, dilation, you've trapped it with the
the plastic in something heavy, now you've got more blood flow to the area, and it's going to cause a better reaction for your immune system and help you with your sore throat or whatever your throat problem is.
There's someone saying, I have several questions for Dr. Miller. May I please have his email, please?
It's on the screen.
It's
on the screen. The live stream. The email is on the screen.
Okay, so the email is on the live stream screen.
Yeah.
And when is he leaving the island, she said? When are you leaving the
I
island?
think 1705.
today, as long as the planes are flying.
5:05 p.m.
Okay, thank you.
4 hours.
Dr. Miller, what would you recommend parents do to a kid, a baby, a 1-year-old who got mosquito bites and then the body's reacting to that, like hives all over the body?
Okay, well,
If it's reacting all over the body, I would get a warm thing of water, put charcoal in it, and put the baby in the body. It's going to start taking all that out of there. The baby apparently has a sensitivity to when a mosquito bites you, it's going to inject something into you, an anticoagulant, so that when it takes your blood up, it doesn't get a big blood clot in its nose, So basically, it's whatever it injects, and that's why you get malaria, because they inject, and if the mosquito has the parasite in its own system, it's going to inject it into you. So basically, the child is allergic to or sensitive to whatever that is that's injected. Normally what happens, the first mosquito bite of the year is going to be the worst one. Then your body mounts up an immune system against it. So my recommendation would be strengthen the child's immune system. You can give a child hot and cold treatments. Even your child, 3 minutes in the hot. Well, no, I would. Yeah, 3 minutes in the hot. Put him in the cold and go back and forth a few times. Now he's not going to be happy. He's going to be screaming and crying when he gets in that cold water. But you want to make the immune system strong. I carry with me. This is my oil of oregano, or oregano, however you want to pronounce it. It's from Greece. This stuff is powerful. Now, you wouldn't want to give much to a young child. What I would do with the child, especially a 1-year-old, I put a drop in some water, mix it up, and pour some water in another glass and add more water so it's very much diluted. Because this stuff, it'll kick an adult. 3 drops of this will kick an adult really bad. But again, it strengthens the immune system. Give the child things like echinacea tea. There's many good teas, garlic tea, that will strengthen the child's immune system. And hopefully that would help. But charcoal poultices over the area where the child gets the mosquito bite can be very helpful. Take, just something as simple as this, taking those toxins that are causing the reaction out of the child's body.
When you have rashes on your arm like that, what is good? Is charcoal good?
Charcoal is good.
Aloe vera would be good. Hot and cold contrast would be good. It depends on what's causing the problem. See, the basic principle of health is reason from cause to effect. If I have a rash, what caused my rash? I got near a lacquer tree, which is very big in Japan. You touch it, it's like poison ivy in America. And so you got to treat that. But charcoal would be very good too. You have a rash, charcoal poultice, or just putting it in some charcoal water to pull out the toxins. So those are some of the things that can be done, which can be very helpful for you.
I have a question for you. I believe it was yesterday's lecture or the day before, we talked about the importance of bacteria, about certain bacteria are good to have in your stomach. Also during the course of the series, talked about how fermentation is not good to have in the stomach. So what is your view or thoughts about people who eat natto, which is fermented, and it's going in your stomach? Even though the results seem to be good, is that fermentation piece.
You know, natto is very popular in Japan. Kimchi is very popular in Korea. And every society has something that's very popular in their diet. America has Big Mac hamburgers. That's popular in their diet that's really not the very best thing in the world for them. Anything that is as desiccated and as like natto. I mean, I've had 3 natto soybeans, and I barely could choke those things down. I'll never try it again. There are benefits in the natto. It's got a lot of probiotics, a lot of bacteria in there. That's the part of the fermentation process. But if your flora, your bacteria in your gut is at the right level, why do we have to keep putting more in there? If you have antibiotics, if I have antibiotics, now I probably won't try to choke down a natto, but I'll take some miso, or I'll take some sauerkraut, I'll take something that's going to have enough probiotics in there to rebuild my flora in my intestinal tract. I'm not going to make a major stand on you can't eat fermented foods because too many people eat the things. I mean, I love miso soup. Miso is a fermented process. But I wouldn't try to major on those things because a fermentation process in the body will continue the fermentation process. And it can cause ferments all the way through your body. Some people maybe know. Maybe we got immune to those things. I don't know. But we really recommend that we don't eat we recommend we eat none. But we have to. Bread is a fermented process. The yeast rising the bread is a form of fermentation. That's why in the Bible, on certain feast days, you ate unleavened bread because fermentation is a system of breaking down. Wine is a system of breaking down. So they didn't give wine on those celebrations. They gave grape juice. Wine is a fermentation process, which we know that wine is bad for the body. So it's barely best. And I don't know what the pH of natto is. I don't know what the pH of miso is, but I know that many fermented foods probably have a very low pH, which is not good for us either. Okay, are we done with the questions?
Well, just one more. If you have a consistent pain in your neck, I've been told it could be from having mercury poisoning, but there could be 2 or 3 other reasons why you're having that. Is there anything you recommend to do for that?
Well, you know, if you have, I mentioned a pain in the neck, anything you can do. It's hard to diagnose sitting across the room, but if it could be caused, I haven't heard mercury causing that type of a pain, but you can get mercury out of the body, just like you can get aluminum and lead by certain chelating herbs. We mentioned them the other day. You can take garlic chelates, cilantro, parsley. There's lots of good foods that will take these things out of the body. You can also, it might be just that you've got a tension, a muscle. And you can have a muscle in spasm for years. You've injured yourself. And so the body's always got that rigidity. Trying an ice massage over that area. I had a woman last year, she had multiple sclerosis. She had a lot of pain, she couldn't sleep at night. I recommended that at night her husband give her an ice massage on her spine. She was taking 34 medications a day. She went down to 2. She could sleep like a baby with no pain. Just the ice massage. People have frozen shoulders. An ice massage can relieve that. Heat. Putting heat on the area. If you've got this tension, it can relax the muscles. Giving a massage to the area could help the area. Putting charcoal poultices on the area can take up the pain. Unless we know what's causing the pain, what I would normally ask a person, I'll ask you, how long have you had the problem?
It's been several years.
Oh, it's been several years.
The first thing I did was I had all the mercury amalgam fillings taken out by somebody.
Okay. But the question, the reason why I ask the question is, usually if a person can, if I can ask a question and it pinpoints a time at the beginning of the issue, then I say what happened near that time. You know, did you have an accident? Did you have a big life crisis? Whatever it was is probably what's causing or exacerbating the problem in your neck. So you got to find out what's causing. My recommendation, if you push on your neck, is it sore when you push in a particular area? If you're sore, when I do a massage on a person, I will palpate every once in a while. I'll find a nodule. We call that thing a trigger point. It means there's a little piece of muscle in a spasm. What I will do then is I will press it very hard for about 8 to 10 seconds and then release. That will over tense and then it will relax. And usually in a day or two, it's gone. So my recommendation would be do some hard massaging on that area. It's going to hurt, but to see if that will not release it, and then you won't have the pain anymore. Okay? Yes?
Just mentioned trigger finger. The doctor said I have a trigger finger here. It curls up, and then it'll flick out. But as it curls, you can't do it because it hurts. And then they say I might have spurs in it. You know, what are spurs?
Well, it's a buildup of something on the particular ligament. And Dr. Thrash had a trigger finger. A friend of mine that lives near me has a trigger finger. And what Dr. Thrash did and what she does, they had surgery. They went in there and they got rid of the thing. Now, you can try doing the hot and cold. You can try charcoal poultices. You can try getting a product called dimethyl sulfoxide, DMSO. Dimethyl sulfoxide mixed with castor oil, and apply that to the area in a hot pack. It can also go in there and do some repair of the damage. But other than that, no. Dr. Thrash, my friend, had surgery, fixed the problem. Yeah. But maybe if we would exercise our hands more, although Dr. Thrash was that woman always worked, but maybe we would keep from maybe forming these spurs on our bodies. I don't know.
What is spurs? What are they? Is it a piece of a bone, or?
It could be an accumulation of calcium in a particular area. All spurs, we don't know what they cause, but usually it's a buildup of calcium. You get heel spurs and in other parts of the body. And sometimes hot and cold treatments will increase circulation, will take away the stuff. Putting turmeric on them or in the body, take up the inflammation. Maybe that would work. There's so many things we can do. Yeah. Matter of fact, look in this book, this Dr. Thrash's book, and see what she says about spurs. I'm sure she mentions them. She mentions about everything in this book. Did a great job.
One more little thing. Like at night, I usually sleep in a t-shirt or a shirt. But in the morning, it be wet around the collar. And I don't realize I'm sweating. So what is that from? Just waking up with a wet collar.
I don't know.
First time you heard that?
I don't know. That'd be a mystery to me. Why we'd have we wake up wet if we have. Why it's just a collar? Maybe you drool. I don't know. Usually,
all around my collar.
I understand that, but usually we would have wet clothing because we sweated in the night. But just a collar, that would be a mystery to me. Yeah, I don't know.
That's something good you can work on.
Yeah, right. Okay. Well, I think we pretty much exhausted everybody, especially myself. And about time to go pack. Eat some of that spaghetti and pack. I guess we need to maybe call the airport to see if flights are flying, or at least why my flight is flying. You done? Turn it off.